out of the room. We will, let's see. We have 26 bills on the agenda for today, and a lot of complex bills, so it's going to be really important that we do have it quiet so we can hear what everyone is saying. We will, because of the 26 bills, we will keep it to 2. You know, I can't hear. Thank you. We do have 26 bills, so we will have a lot to go through. We will keep it to 2 witnesses, 2 minutes each, with everyone else just giving their name and that they are in support or opposition. We are taking, with permission from Assembly Members Portantino and Assemblyman Bill, we are going to have Assemblyman Liu come first. Item 15, AB 911.
Good afternoon, Madam Chair and
Welcome.
Senators. Thank you. AB 911 is an important measure that seeks to address emergency department overcrowding and help save lives. We have reached a compromise with the California Hospital Association, and their most recent amendments are located in your binders, and that should remove their opposition. Congestion in the ER is becoming increasingly problematic, causing extended wait times, ambulance diversion, and delay in treatment for urgent care. Currently, patients are boarded in hallways and waiting rooms while waiting transfer into the inpatient unit of the hospital. Nothing in current law requires a hospital to work with the emergency department to alleviate ER overcrowding or increase patient flow into the inpatient unit. This bill would improve ER care by requiring all hospitals to create and implement a full capacity protocol plan. This plan would require hospitals to assess the results of a crowding scale every 4 hours and then provide solutions to each stage of the overcrowding scale. I would like to thank both CHA and Cal ASAP for the ongoing commitment to address ER overcrowding, and I have witnesses here in support.
First witness.
Tim Madden, representing the California chapter of the American College of Emergency Physicians. We are the sponsor of this important piece of legislation. AB 911 represents an opportunity to address the overcrowding crisis that faces our ERs. As you all have heard multiple times in this committee, the number of patients coming into the emergency room is increasing on a daily basis. We're seeing this even more so over the last year or so with the cuts at the county level to health services, and we're also anticipating an even increased patient flow with the impending cuts at the state level to health services. As a result of the increase in patients, as Mr. Liu mentioned, there is an increase in wait times. This is most prominently seen in boarding times. Boarding is the term used to describe when a patient is stabilized in the emergency room and is waiting for a bed upstairs in the hospital or waiting to be transferred to another facility. Increased boarding times reduce outcomes. They also increase hospital stays. The process as outlined by Mr. Liu represents an opportunity to reduce that, and we've seen that occur in hospitals across the country. As the patients move upstairs more quickly, the wait times reduce, the outcomes improve, and the patient satisfaction increases greatly. As Mr. Liu mentioned, we've worked extensively with CHA on this. We are happy that they have moved to a neutral position, and we look forward to working with them on making minor tweaks to the bill going forward. We respectfully ask for your aye vote.
Thank you.
Madam Chair and members, Connie Delgado Alvarez with the California Hospital Association. We are here today with a neutral position, having removed our opposition. We would like to thank all of those involved, including Mr. Liu and the sponsors, to address the concerns that we had for the ability to create a tool that would measure capacity in the emergency departments. We would like to note that our hospitals are modeling this tool today and as we speak, and it may be necessary for further modifications in the future, but we look forward to working with all the stakeholders to address those concerns as needed. Thank you.
Chris McKaylee on behalf of the California Ambulance Association in support of the bill.
Thank you. Are there witnesses in opposition?
Thank you. We have an approved opposed position on this bill. We don't believe that there's sufficient evidence to show that using an overcrowding score is effective or will have impact on improving emergency room overcrowding for all hospitals in California. Further, individual overcrowding assessment in emergency departments should already be being done on an individual hospital basis according to each hospital's own policies and procedures. And further, this bill does not address preventing emergency department overcrowding. For these reasons, CDPH is opposed to this bill.
Thank you. Next. Okay, before we continue, I understand, Assemblymember Liu, that you are taking the amendments we've asked for?
Yes, and
Is that correct?
Yes, and those amendments actually should address most of what the department just said.
Right,
Because
right.
we've taken out the NEDOCs to
And I want to thank you. I know we've worked on this bill quite a bit, and I think it's a good bill now.
Thank you.
Yes.
Madam Chair? Could the la-
Senator Cox.
Thank you, ma'am. Could the lady explain to me what an approve-oppose position is? Does that mean that the governor has said to the department it's okay to approve this bill, but when it gets to me, I'm going to veto it? Is that what approve-oppose means?
Well, it's not a guarantee of a veto. It's just that we send our position up, it gets approved, and they're approving us to go out with our position. So it's an approved department
I was just
position.
wondering whether it was some sort of code.
Well, we learned something.
Code that I
We
didn't-
learned something new.
I want to ask just one additional
Okay.
question. Now, did the California Hospital Association get the amendment they were looking for relative to the smaller? Is that what I understood to be said? They were going to go neutral in this bill or support it if, in fact, they got their approval for the smaller hospital.
I'll have them answer that.
Senator Cox, we did get the issue addressed with how it relates to
Thank-
small volume hospitals.
Thank you, Madam Chair.
Right. That was taken care of in the amendment.
you.
So maybe that position is changing.
The approve opposed, I love
Yes,
that.
you're right.
I wonder if we could get an opposed approved position.
I'm going to take just a moment. We have enough members for a quorum vote.
Senator Alquist.
Here.
Alquist here. Strickland. Honested. Here. Honested here. Cedillo. Cox.
Here.
Cox here. DeSagne. Leno. Maldonado. Negretti McLeod. Negretti McLeod here. Pavley. Here. Pavley here. Woke. Here. Woke here. We have a quorum.
We have a quorum. Thank you. Comments from the committee? Is there a motion on the bill? It has been moved by Senator Cox. We'll call for the vote, please.
Thank you.
Senator,
Oh, wait. Oh, would you like to very briefly
Instructor
close?
request an aye vote.
Senator Alquist.
Aye.
Alquist aye. Strickland. Honested. Honested no. Cedillo. Cox. Cox aye. DeSagne. Leno. Maldonado. Negretti McLeod. Negretti McLeod aye. Pavley. Aye. Pavley aye. Woke. Woke aye. That bill's got 5 ayes.
That bill has 5 aye votes. It is on call, and we are keeping all bills on call till the very end because members are off in different committees. Thank you very much. Okay. Thank you, Senator Cox. What we'd like to do, both of the bills that are proposed for consent, Item 2, SJR 15 Alquist, and Item 14, AB 830 Cook, have amendments. And so before you, you have a mock-up of the amendments. If you want to take a look at that and see that
We're
you're
okay, yes, ma'am.
and see that you're okay with that. I'd like to adopt the amendments and place the measures back on the consent file as amended. Is there any objection to adopting the amendments by unanimous consent? No? So if no objection, the amendments are adopted, and I'd like to place the bills back on the consent calendar. So now we will vote on the consent
Motion to
calendar.
approve the consent calendar as amended, ma'am.
Thank you.
Senator Alquist.
Aye.
Alquist aye. Strickland. Honested. Aye. Honested aye. Cedillo. Cox.
Aye.
Cox aye. DeSagne. Leno. Maldonado. Negretti McLeod. Negretti McLeod aye. Pavley. Aye. Pavley aye. Woke. Woke aye. It's got 6.
That has 6 votes. We will hold that on call. Senator Leno is not here. He's in another committee right now, so we'll go to Item 3, AB 56, Assemblyman Portantino. Welcome.
Thank you, Madam Chair and members. The number is 16. This is the number of women's lives a year we could save if we enact AB 56 into law. AB 56 does two things. It deletes an outdated reference in the insurance code that limits coverage for mammograms for women based on their age. And while health insurance policies are currently covering mammography to screen for breast cancer, many women are unnecessarily dying because they do not know when to start being screened. AB 56 will help solve this problem by requiring health plans in California to provide information to women regarding when they should begin to be screened for breast cancer. AB 56 does not mandate insurance companies to increase benefits or to provide additional goods or services. It merely requires insurance companies to provide information to enrollees on when to begin to be screened for breast cancer. In addition to the 16 lives this bill will save every year, thousands of other women will have their cancers diagnosed early, not only saving treatment dollars, but reducing the physical and emotional effects for cancer victims. I've been working closely with the insurance companies to establish a system that not only informs women about testing, but one that is easy to comply with and is virtually cost-free. I have with me to testify today Shannon Smith Crowley of the American College of Obstetrics and Gynecologists.
Good afternoon. Thank you, Madam Chair and members. One of the things I wanted to clarify was that coverage is already in the code, but there's confusion because there's some conflicts in the citation of some outdated medical guidelines. In the particular section of code that we're talking about, that it references some age guidelines that are no longer relevant. It says that there's a baseline at 35, which has not been the case for years, and it is correct in 40 and up to start getting mammograms, and that is correct, but it doesn't provide for higher risk women that may need mammographies in their 20s. However, there are other code sections. There's a general code section that says all cancer screening tests are covered, and in 10123.8, it specifically says that there's coverage for the screening, diagnosis of, and treatment for breast cancer. But what happens is that patients or physicians may get a denial citing this outdated section, and they don't have all of the codes in front of them, so they don't know that these other codes exist. So therefore, we think that this cleanup would be very necessary and will not only save lives and treatment costs, but will also help in the administrative costs for physicians. And we ask for your support.
Thank you. Next witness.
Charlotte Newhart with the American Association of University Women, California National Organization for Women, and the Directors of Maternal, Child, and Adolescent Health and Support.
Thank you.
Madam Chair, Scott Coven on behalf of Dave Biome, GlaxoSmithKline in support. And Randy Hicks with Older Women's League in support.
Erin DePay with Planned Parenthood Affiliates of California, also in support.
Thank you. Opposition?
Thank you, Madam Chair and members. Nick Luizos with the California Association of Health Plans. Our association has taken an opposed unless amended position on the notification requirement in the bill. We are not in opposition to the modifications to the coverage language in existing law. I'd first like to thank the author and his staff for working with us. We have suggested a number of amendments, some of which have been taken. We do have a couple of outstanding technical concerns that would allow us to implement this bill in a way that doesn't increase our administrative costs. So we would like to continue working with the author and his staff on addressing those two remaining issues that we have with the bill on the notification side. So we, unfortunately, unless those issues are resolved, we are not able to remove our opposed unless amended position at this time.
Jason Gappart with the Association of California Life and Health Insurance Companies. As like CAP, we have an opposed unless amended positions. We have the same concerns that are still outstanding, and we'll continue to work with the author.
Thank you. Comments from committee? Senator Onestad?
Just a comment that's related to this concept of informing females about this service in the anticipation of getting some even earlier age than 40. and yet the overwhelming majority in this building seems to be so enamored with universal health care. Let me just remind you folks that in Great Britain, where they do have universal health care, a screening mammogram is done every 3 years to people over the age of 50. There is no benefit for somebody under the age of 50. In France, there is no benefit for under the age of 50, and consequently, these countries have even higher breast cancer rates and better survival rates than the United States, and yet we insist on going to this kind of rationed universal health care.
I guess my only comment to my very respected colleague is that it's been documented that there are many young Latinas who don't have coverage and who get breast cancer even in their late 20s. And because they wait so long, many of them die. And so, and I've noticed this in my district in Santa Clara County in San Jose. So I think there's a need for the bill. Are there other comments?
Madam Chair.
Senator Cox.
I wanted to inquire, according to our notes, that there are at least 6 other national guidelines in the marketplace, so to speak. Which guideline would be used?
Each health plan has a medical necessity guideline that they develop. They have an advisory committee of clinical people that look at the guidelines and that they come up with those medical necessity guidelines. And there's a fair amount of consistency amongst the guidelines. There's some slight variations.
Does it make any difference to you that the guidelines are not the same?
Well, I believe that all of the guidelines suggest starting mammography at age 40, and that's the big thing that we're trying to get. It's not as important, I think, after that in terms of whether it's every year or 2 years, but the beginning of mammography for average risk women.
All right. Thank you, Madam Chair.
Thank you. Were there any other comments? Senator Woke has moved the bill.
If I could respond.
Would you like, Assemblymember Portantino, would you like to respond?
Thank you very much. A couple things. We have tried to work on the notice requirement with the insurers, and the original Chubert review based its cost on a written notification to every patient, and we've been suggesting that routine emails or in the newsletters or in when the coverage is renewed, that there's alternative methods of notifying women of what their rights and good health practices should be. So we're not trying to be onerous, but we're trying to say to the insurers that you will save lives by notifying women to come in to have mammographies. We also feel it's important, as science changes and as the risk factors change, seeing that more and more younger women are being affected by breast cancer based on 9 other risk factors, that it's important to have that frequent communication with your policyholder. So we think it's going to save lives and save the insurers money over the long run, and we're trying to be very cognizant of how to do that in a way that works for them and works for the patient. This bill came to me in the post office. I had a local woman who was 40 and went in for her first mammography and was discovered that she had cancer in both breasts and had to be rushed in and have an immediate double mastectomy. And women came up to me and said, you know, please can you try to do something, because it sent a chill through the community that something like that could happen without any precursor or pre-diagnosis. So people understand the necessity of being informed and then being proactive and having a healthy, good system. So that's the genesis for this bill, and I respectfully ask for an aye vote.
Thank you. Call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? Onnested, no. Cedillo? Cox? Cox, no. DeSaulnier? DeSaulnier, aye. Leno? Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? Woke, aye. It's got 4 aye votes. 4.
That bill has 4 aye votes. It is on call. Thank you very much.
I have one more.
And you have one more yes.
Item 9.
Item 9,
AB 564.
AB 564.
Thank you, Madam Chair and members. I'd like to begin by accepting the recommendations found in the committee analysis in comments 3, 4, and 5. I'd also like to thank the committee staff for working with my office to both improve the bill and address the stated concerns of the opposition. This bill is jointly authored by Assemblymember Lowenthal, so I want to make sure that her joint authorship is also acknowledged. AB 564 is an important bill which will provide clear oversight of taxpayer dollars used to fund drug treatment programs throughout the state. Specifically, AB 564 clarifies that the limits placed on executive compensation by the National Institute of Health for federal grants shall be the limit of executive compensation from all public money provided to a drug treatment center. Additionally, the bill will specify that an executive who collects rent from a treatment facility may not receive any compensation from public funds unless they can meet the standards set forth by the Office of Management and Budget relating to cost principles for nonprofit organizations. In these tough economic times, the public demands to know that their money is being spent wisely and on the purpose for which it is intended. When they read stories about executives making $400,000 to run nonprofits funded by public dollars while simultaneously owning an interest in the company, collecting $2.7 I believe, $1 million, is that $1 million a year in rent, they begin to question the necessity of the program and doubt the efficiency of all of us. AB 564 will serve as a strong example of our commitment to oversight and ensure the public dollars intended to treat people with addictions will not be going to pay exorbitant executive salaries, and I ask for an aye vote. With me today to provide additional testimony and answer technical questions is David Peters, representing the California Association of Addiction Recovery Resources.
Thank you, Mr. Portantino, Madam Chair and members. My name is David Peters. I represent the CAR, the California Association of Addiction Recovery Resources. We do not have an official position on AB 564 at this time. My Board of Directors is having a regularly scheduled meeting on Friday, at which time this will be taken up, and I anticipate that they will take a position on this bill at that time. So I am here today, instead of officially supporting the bill, to speak to the massive importance that CAR members place on sustaining or rebuilding the public's trust and the trust of this legislature and of the executive branch in how most nonprofit alcohol and drug treatment programs use public dollars. With that said, we are also not here to fight with any other program or association, but I'm here to assure you that our programs live on shoestring budgets all the time, and not just this year. We have to fight for every treatment dollar, and those dollars are not being used to enrich individuals. The people who work in this field are definitely not in it for the money, but for the love. We have ethics and codes of conduct, and we are accountable to you. We help people whose lives and whose families have been devastated by addiction. Alan Zarembo, and I hope I'm pronouncing his name right, the journalist who produced the piece in the LA Times on June 11th, his piece is an indication to us that your trust and the public perception of what nonprofit AOD treatment programs really do has been harmed, and that bothers us a great deal. Excessive salaries and hundreds of thousands of dollars in deferred compensation is not the norm. It's far from it. It's light years from it. Top management serving as its own board of directors, setting their own salaries, and owning the real estate to which the public dollars pay the rent on is unheard of as far as we know at CAR.
You might want to paraphrase, please. You're done?
I'm done.
Great. Thank you.
Thank you, Madam Chair. Members, Tom Renfrey with the County Alcohol and Drug Program Administrators. We don't have a position on the bill either, but we do have something to say about strict accountability on the use of public funds in our programs. Many of our counties contract with providers to provide alcohol and other drug treatment services. And because federal funds are also involved, these contracts have standard clause stating that no part of any funds provided under this contract shall be used by the contractor or any subcontractors to pay the salary of an individual at a rate in excess of level 1 of the executive schedule. So we, again, are committed to ensuring that public funds that go into these programs go for direct treatment services. Thank you.
Thank you. If others in support would just like to state their name and that they are in support, please.
Rod Libby. I'm with representing CADP, the California Association of Alcohol and Drug Program Executives. We oppose the bill.
Oh, so I hadn't called for opposition yet, but that's fine. So you're opposed. Thank you very much. Others in opposition?
Can I add anything to that opposition?
Well, let's just wait 1 minute, please. Opposition would be 2 minutes, 2 witnesses, 2 minutes each. So yes, if you would like to do that.
Okay, won't take 2 minutes. Currently, there is in the California Government Code, Section 12586G, a statement that the Board of Directors of a nonprofit corporation shall set the salaries of the CEO and CFO of that corporation, and it shall be just and reasonable. I think the way the law works in this case is that if there is a thought that it's not just and reasonable, that the Attorney General would investigate that. So I think there's a good precedent with this government code in terms of how these matters are managed through a board of directors of a nonprofit corporation, and frankly, we feel that that's enough to cover the situation.
The last sentence one more time. Yes.
We feel that the government code that exists is appropriate. The government code 12586G, that's the one that says that the board of directors of a nonprofit corporation shall set the salaries of the CEO and CFO of that corporation, and that it shall be just and reasonable.
So the amendments that were just offered don't satisfy you?
No, I don't. I don't think that they're necessary.
You're saying
I think that there is good law in place.
You're saying that there's enough in law in place already, and that we don't need to do more than that.
Exactly.
Others in opposition?
Good afternoon. Glenn Backus for Drug Policy Alliance, proponents of Proposition 36. We are not actually opposed to the content as drafted, in part because we didn't have a chance to study it and understand it. 3 weeks ago, a bill that was a transportation bill was turned into a health bill. We tried to analyze that language. It was changed yesterday by committee. We saw that language only yesterday. We cannot evaluate the potential outcomes for people who are addicted and their access to drug treatment on such a quick turnaround. We would request that this bill be introduced in 2010 and follow the two committee rules so that we could study it, analyze it, and take a position. We oppose the process. We do not have a position on the content.
Thank you. Others opposed?
Madam Chair, members, Donna Brownsey, representing the California Opioid Maintenance Providers, the narcotic treatment clinic system. And we had a hard oppose on the bill as it was the stripped and amended version. We have not had an opportunity to review these amendments. It's moving in the right direction. May still have some concerns, and just wanted to note that most of the programs, the narcotic treatment programs, are a mix of private and public funds. So that's one of the issues that will be of concern to them, which is I think people would understand that to the extent that the program receives public funds, that they would follow the laws and be respectful of any limitations. But if they have private funds and if they are a large clinic system, that the salary be commensurate with the duties and responsibilities in order to have high-quality administrators for those programs. So I just wanted to leave that with the committee.
Thank you. And on that point, I'd like to make a couple statements and then go to other committee members. I want to clarify a few things. Number one, this bill is a gut and amend, and this is the bill's first hearing. Number two, the bill would institute a new set of standards for nonprofits. 3, committee amendments would require nonprofits to meet existing federal standards. And those were some of the things I wanted to say. And then I did want to ask the author, as he speaks later regarding the bill, to explain his rationale for limiting the bill's application to Prop 36 funds only. And I am supportive of the bill as it has been amended, but those are just some things I wanted to put out there, and we do have some questions from committee, starting with Senator Leno.
Thank you, Madam Chair. Your comments clarify a few of my immediate questions, so thank you for that. The genesis of the bill came from the situation in Tarzana, so we don't know how widespread this phenomenon is.
Correct.
And you are taking as authors' amendments the conformity between federal and state.
Correct.
Okay, so that eases some of my concern right off, but I hope you'll continue to pay attention to some of the oppositional
Absolutely.
Voices.
Absolutely. And we are, I mean, it is going to apply to all drug treatment centers, not just those under the proposition. So we're cognizant of that.
Thank you.
All right, are there other comments or questions? The bill has been moved as amended by Senator Wolk. And Assemblyman, if you'd like to speak to some of the concerns that were raised in your closing.
Thank you, Madam Chair. Yes, I can't do anything about the timing of the bill, but most of you know that this has been a theme that I've been pushing since I first came to Sacramento, whether it was dealing with the UC's executive compensation practices or other transparencies and other what I would call good government, winning the public's trust in how we do business proposals. So having read the article in the newspaper and then also noting that Assemblymember Lowenthal also saw the same problem right before us, I felt the need to act quickly, especially at a time when we are in a severe economic situation where money is limited, where we're potentially cutting severely our safety net and many programs. It just seems like the right way to go to make sure that the money that's invested actually goes to treat those folks who need help versus exorbitant salaries for top administrators who, under the current law, control the policy-making body that would approve their salaries. So it just seemed prudent to make it conform with federal law, but also restrict the use of public money. So that was the genesis. That's why we're here, and I respectfully ask for an aye vote.
Thank you. Well, the bill has been moved as amended by Senator Wolk. If there are no other comments, we'll call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Honested? Honested, aye. Cedillo? Cox? No. Cox, no. DeSaulnier? DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? Woke, aye.
That bill has 6 votes, which is enough to get out, but we're holding everything on call.
Thank you
very much. Next, we have Assemblymember Bell, item 4, AB 244. Welcome.
Thank you, Madam Chair. Madam Chair and members, AB 244 ends discrimination against patients with mental health disorders and substance abuse issues by requiring insurers to cover treatment for those illnesses equivalent to the coverage provided for other medical conditions. Of the 11 million adults who have reported having unmet need for treatment, nearly half, or 5.5 million people, reported cost or insurance issues as a barrier to treatment. As a result, many of these people in our society with mental illnesses and substance abuse are unable to obtain treatment and fall into the county's indigent health care pool, emergency rooms, and unfortunately the state and county jails. According to the U.S. Department of Health and Human Services report on national expenditures for mental health and substance abuse treatment from 1993 to 2003, the private insurance industry has been shifting the cost of these illnesses onto state and local government and the taxpayer. As we review our state budget and the many factors that have led to our massive deficit, I ask you why this industry is subsidized by millions of dollars through this process of cherry-picking healthcare coverage. And I ask you, did untreated illnesses in the mental health and substance abuse area make our deficit worse? It's time for health insurance coverage to cover all aspects of health and stop the practices of carving out illnesses they do not want to cover. This bill is a cost-effective way to help people who are paying for health insurance to actually get the full scope health insurance they need. Madam Chair and members, Congress passed the Parity Act in the United States Congress in September, and the President Bush signed the bill. It's now a federal law. And I urge California to also adopt a parity law. I urge an aye vote.
Thank you. 2 witnesses, 2 minutes each.
Madam Chair, Randall Hager with the California Psychiatric Association. While in another position in 1999, I was a legislative director that actually pushed the original parity bill, AB 88. And it was a project of family members and people who were mentally ill, and its aims were to basically ease the financial burdens on families and individuals who had to pay disproportionate costs for mental health care when they could pay much less for any of the other health care services available to them. So we passed that law. It's been in effect. It ended discrimination for 9 disorders, and this bill basically takes us the rest of the way and makes sure that there is no discrimination within our statutes with regard to any mental disorder, and in particular substance abuse treatment. As Mr. Bell said, we do have a federal parity law. The consequences of not being able to offer services on the same terms and conditions are that people will end up less productive, families will suffer, there are even worse consequences in the form of arrest and incarceration, homelessness, and sometimes death and suicide. So these are very important issues. We commend the bill to you, and we urge your aye support for this.
Next witness, please.
Gary Passmore with the Congress of California Seniors. This is a measure that is long overdue in California law, and we urge your aye vote.
Thank you.
Tom Renfrey with the County Alcohol and Drug Program Administrators. We're in strong support.
Beth Capel on behalf of Health Access California, as was reflected by our prior witness. This is part of the undone business of HMO reform. Governor Davis signed the original mental health parity law precisely because there had been a cost shift from the private sector to the public sector. So it's time to get this fixed.
Thank you. And that was the second witness in support. So there's just say your name and that you were in support.
Deborah Doctor from Disability Rights California in strong support.
Okay. Glenn Backus for Drug Policy Alliance in support.
Tom Riley with the California Academy of Family Physicians in strong support.
Kirsten Barlow with the California Mental Health Directors Association in support.
Judy Wallen with NAMI California in strong support.
Helene Meshar with the California Association of Alcohol and Drug Program Executives in strong support.
Robert Harris on behalf of the California Society of Addiction Medicine in support of the bill because this is something that all large private self-insured
We've had 2
people do.
witnesses, and thank you very much. You got by with a few extra words there.
Okay, next. I apologize, Chair. Farrah McDade team with the California State Association of Counties in support.
Thank you.
Ed Guzman on behalf of California Alliance for Retired Americans, we're in support.
Thank you.
Madam Chair, members, Brian Lundgren in support.
Thank you. Witnesses in opposition.
Good afternoon, Madam Chair, Senators. Julie Ann Broyles here on behalf of the California Association of Joint Powers Authorities. We are here in opposition to AB 244, which we believe is something that is going to increase costs for local agencies and special districts and joint powers authorities that provide health coverage for public employees throughout the state because of the fact that you are asking for a parity on this particular type of, on the mental health coverage. We do believe that it's inappropriate to exempt state agencies such as PERS and DHCS from coverage of this bill. You're going to lever this burden on public agencies and would ask for a no vote.
Thank you.
Jason Gaphardt with the Association of California Life and Health Insurance Companies. According to CHBRP, this is one of the more expensive mandates. I think it will increase premiums by about $46 million. Also, we feel it's unnecessary at this time. According to CHBRP, it concluded that 99% of individuals in the policies subject to this bill already have coverage for non-severe mental illness disorders, and 64% total have coverage at parity. And also 94% of individuals have coverage for substance use disorders, 64% at parity. For these reasons, we are opposed.
Thank you.
Stephen Lindsay with the California Association of Health Underwriters. I would note we are listed under the support position, and that's an error. We are opposed to the bill.
Thank you. We take note of that.
Madam Chair and members, Nick Luizos, California Association of Health Plans in opposition.
Dan Chick with HealthNet in opposition as well.
Sherry Lowenstein, Department of Managed Health Care, also in opposition.
Mark Burdett, California Chamber of Commerce, also in opposition.
Thank you. Comments from the committee? The bill has been moved.
Madam Chair.
The bill has been moved by Senator Woke, and Senator Cox has a comment or question.
Thank you very much. Mr. Bill, I've voted on 2 different occasions for adding additional mental disorders to coverage. I frankly believe this bill goes a little too far. Let me tell you what I believe this bill adds and why I think it, for that reason, why I think it goes too far. We already have mandated schizophrenia, schizoaffective disorder, bipolar, major depression, panic disorder, obsessive compulsive disorder, persuasion development disorder, or autism, anorexia, bulimia. And then we would come along now and add things such as narcissism, kleptomania, sleepwalking, voyeurism, exhibitionism, malingering, sibling relations problems, and phase of life problems. And so for that reason, Mr. Bill, I'm going to vote no today, even though in years past I have voted to expand the coverage of for this kind of event, but I do intend to vote no today on it. Just believe it goes too far.
Thank you, Senator Cox. The bill has been moved by Senator Woke, and we'll call for the vote.
Senator Ahlquist?
Aye.
Ahlquist, aye. Strickland? Onnested? Cedillo? Cox?
No.
Cox, no. DeSagne? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Pavley? Woke? Woke, aye. It's got 3 ayes.
That bill has 3 aye votes. It is on call.
Thank you.
Okay, thank you. Next, we have Assemblyman Ruskin, file item 5, AB 366. Welcome.
Thank you, Madam Chair. Madam Chair and members, AB 366 would provide reimbursement to hospitals for the cost of orthopedic implants for Medi-Cal patients with malignant bone tumors. This would be accomplished by requiring CMAC, the California Medical Assistance Commission, in negotiating Medi-Cal inpatient contracts to consider as a factor specialization orthopedic implantation related to bone cancer. This will allow the cost to be negotiated and then thus lowered. The new implants allow patients with bone cancer, particularly children, to avoid amputation. These implants for children grow magnetically as the children grow. While they cost as much as $30,000 on the front end, they save money in the long term by avoiding the annual replacement of external prostheses, estimated at $54,000 over 6 years for above-knee prosthetics, as well as the 2 or 3 additional invasive surgeries that children under the age of 19 often require after amputation to correct overgrowth. Medi-Cal does not reimburse for the implants used in this limb-saving surgery. Hospitals continue to provide this surgery, but financial losses may make this unsustainable and restrict the number of Medi-Cal patients who can be served with this new procedure. creating a reimbursement policy that is consistent with the current standard of care for cancer is necessary so that Medi-Cal beneficiaries have the same access to this limb-saving care as other Californians. A change in policy is critical for providers and cancer patients, especially children whose ability to walk, run, and play ought to be preserved. I ask for your aye vote.
Thank you. Two comments, two witnesses, 2 minutes each.
Thank you, Madam Chair and members. Diego De La Garza with City of Hope, with the sponsor of the bill. Currently, Medi-Cal pays for amputations and external prosthetics, but not for the internal prosthetic and saving the limb. We believe this is a policy that needs to be changed. We ask for your aye vote.
Thank you.
Madam Chair and members, Barbara Glazer on behalf of the California Hospital Association, representing over 400 hospitals in strong support today. This measure is really just coming up to date with the standard of care, and in the long run will not only is it a quality of life issue, but will save money in the long run.
Thank you. Thank you. The bill has been moved by Senator Cox, so we might make note of that. Thank you.
Angela Gilliard with the University of California in support.
Thank you.
Deborah Doctor, Disability Rights California in support.
Thank you. I understand there is no opposition, but is there any opposition? Been moved by Senator Cox. Are there comments from committee? In that case, we will vote for the bill.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? Cedillo? Cox? Aye. Cox, aye. DeSaulnier? Leno? Aye. Leno, aye. Maldonado? Negretti McLeod? Aye. Negretti McLeod, aye. Pavley? Woke? Woke, aye. It's got 5 ayes.
That bill has 5 votes. It is on call.
Thank you very much.
Thank you very much. And Mr. Strickland was right here, and so
Strickland, aye.
It now has 6 votes, which would be enough, but we're keeping all the bills on call.
Thank you.
Thank you. Mr. Monning? Let's see. Assemblyman Monning. We're on file item 6, AB 398. Welcome.
Good afternoon, Madam Chair and members. I'm here to present AB 398, which transfers the California Traumatic Brain Injury Program from the Department of Mental Health to the Department of Rehabilitation. I've made final clarifying amendments to the bill at the request of the Department of Rehabilitation, which were agreed upon by the sponsors and me. California is home to the highest number of acquired traumatic brain injury, or TBI, cases in the nation, with over 350,000 current survivors and an estimated 22,000 new cases in California each year. Acquired TBI is caused by an external force to the brain, usually caused by a fall or a motor vehicle accident. Currently, the ongoing wars in Iraq and Afghanistan are adding thousands of additional victims of TBI. Created over 21 years ago, the TBI program has been reviewed and extended by the legislature 5 times. The program runs 7 sites statewide that coordinate services to assist adults with TBI so they can live productive and independent lives. The transfer is necessary because TBIs are primarily a traumatic physical injury rather than a mental health condition. Over the years, the Department of Rehabilitation has demonstrated the capacity and expertise needed to properly and effectively evaluate and assist the TBI sites. AB 398 will provide TBI survivors with a better match in regards to administering programs and coordinating services that address rehabilitation and independent living. I respectfully ask for your aye vote this afternoon, and Madam Chair, I'd like to present witnesses in support of the bill.
Thank you.
Thank you.
Charlotte Newhart with the California Foundation for Independent Living Centers, the sponsors of the bill. As the Assembly member mentioned, the Department of Mental Health is really not the best place for a program that is really a physical condition. And so we strongly believe that this will be helpful. Secondly, I think one of the most important parts of this change that is with the program going to the Department of Rehab, we will be eligible for a significant amount of federal money that's directly related to rehabilitation. And this is an important part of the issue since the Department of Mental Health does not have access to those funds. So we also strongly believe after 21 years, 6 times approval by the state legislature, that the time has come to make both this move and to make it a stable program. Thank you.
Thank you.
I'll pay for it. Deborah Doctor from Disability Rights California, in very strong support of this bill. We have a couple of staff members who work almost exclusively with people with traumatic brain injury, and we're the sponsors of an earlier bill, AB 1410, which required the state to look for some more federal money for people with TBI. And we're very supportive of this bill because we do believe, I mean, it's not just us, it's a fact that TBI is not a mental illness. It's caused by physical trauma, and so the logical place for this program to be situated is in the Department of Rehab. Many people with traumatic brain injury are looking for rehabilitation, want to go back to work, either the work they did previously or some other kind of work, and we think this will help them to do that. Thank you.
Thank you.
Madam Chair, Brian Lindgren on behalf of the California Ski and Snowboard Safety Organization in support. Thank you.
Thank you. Is there opposition? Senator Strickland.
Thank you, Madam Chair. Assemblyman, I notice in the bill that currently as drafted, it deletes the sunset date. Would you be open to maybe doing an amendment for, because we traditionally like sunset dates, a 5-year sunset, maybe 2014, 2015. Would you be okay with that?
Well, Senator, I appreciate the question. The removal of the sunset was actually an amendment we accepted in the Assembly Health Committee, and the rationale behind that is because of the string of success of the program. If we put in a new sunset, it jeopardizes potentially funding sources. And so the stability sought by removing the sunset actually avails the program to more funding options. So that's the rationale behind it. So with all due respect, I would like to see if we can win support as drafted with the inputs from Department of Mental Health, Department of Rehab, and the requested amendments of removal. Thank you.
Madam Chair, could the gentleman explain?
Senator Cox.
Could the gentleman explain his statement about because it doesn't have a sunset, you're eligible to get additional benefits? Could you explain that?
Yes, Senator. It's actually, we're informed that the removal of the sunset conveys to potential funders a stable, ongoing program, and that when they see a sunset in there, the concern is that it's not going to be an ongoing program, and it potentially jeopardizes private funding sources, foundations, and potentially federal funding sources.
And do you have any specific private foundation in mind?
I'm not aware of the foundations. I don't know if our witnesses have data.
Would the witnesses just testify that adding a sunset clause would preclude you from getting some grants?
We presently have 7 centers that are operating. Some do receive private funds, and they do have difficulty going to some of the major foundations because in the 21 years, this has been reviewed 6 times by the state legislature. It's a very short period of time in which they're looking at renewal of the program, and what they are hoping to do is put in larger sums of money for much longer periods of time.
I understand. I don't think you answered my question, but thank you very much. Thank you, Madam Chair.
Well, what I would suggest, I happen to believe in sunsets, and I understand how the bill was originally written, and that in your Assembly Health Committee you took the amendment that you took. But what if we had a sunset of 10 years? I think that would assure people who, and whoever would like to fund it, that it's stable enough, and yet in 10 years a future legislature could look at it again, as sometimes things do change.
Madam Chair, could I just throw another thought into the conversation? Sure. Could you give us a little history? There's some noted in our analysis, but this program was originally created in 1988. There was a 3-year program to demonstrate effectiveness. After that 3 years, the sunset was extended another. Can you give us that history? So you said there have been 6 extensions.
6 extensions by the legislature.
Okay.
And I think that that's in the analysis, clearly stating all the dates. And unfortunately, I didn't, I might have it here and could read it. But the legislature renewed it has renewed it 6 different times.
Madam Chair, I definitely see the value for new programs to have sunsets. This is not one of those programs. This has now been around 21 years. I think it's our legislative responsibility to either look at the history, determine its success or failure, and after 6 extensions, if it's not of value, let's get rid of it and stop wasting everyone's time. But clearly we've determined it is of value. So I think we've made use of sunsets repeatedly. I think it's about time, and then add to that the benefit of removing the sunset for potential funders. I think it's proved itself at this point. If it were in its first sunset or its second, I think a longer sunset might have more reason to it, but after 6 of them already.
Madam Chair, may I?
Were you through,
I'm
Senator?
through. Sure.
Senator Cox.
I do, in fact, believe that 10 years is a reasonable time frame. This is going from one agency to another agency, and that then makes it a new program for the agency that it's going to. And it would seem to me that this legislature has been talking about accountability and about transparency. 10 years is a rather long period of time that I don't believe it would jeopardize any grant program, and it just seems to me that, Madam Chair, that was a reasonable recommendation on your part. It is a new program. You can call it anything you want, but it's a new program for this particular agency.
I'd like to stay with the 10 years. Thank you, Senator Leno. Particularly with changing from mental health to rehabilitation, I really want to see how it is dealt with, the accountability in it, and I think a future legislature might really want to look at it. So,
Madam Chair, I appreciate the expression of those concerns. I appreciate Senator Leno's articulation of what I believe is the argument not to go with it. But in deference to Madam Chair and the committee, I would find the 10-year sunset as an acceptable amendment because I think the real issue here is the transference from mental health to Department of Rehab. I don't want to jeopardize that objective. It's affecting people in their day-to-day treatment options. I just hope we don't lose potential funding sources, but I would accept that, and I appreciate the committee's seriousness in looking out for the interest of Californians. Thank you.
Thank you. Any other comments?
Move the bill.
The bill has been moved by Senator Strickland, moved as amended. So we will call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onnested? Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? Woke, aye. It's got 6.
That bill has 6 votes, which is enough to get it out, but we're holding all the bills on call since we have members in different committees.
Thank you, Madam Chair. Thank you, members.
Former Senator, current Assembly Member Chesbro has file item 12, AB 754. Welcome.
Thank you, Madam Chair. It is a great comfort to me to be standing before a committee that I served on my entire 8 years in the State Senate. It's a very familiar room to me. Madam Chair and members, over the last year there have been significant disruptions in the reimbursement of county mental health Medi-Cal payments due to problems in communication, accounting, and claims processing. These disruptions have led to increased federal scrutiny, multi-year county payment deficiencies, and millions of dollars in delayed reimbursements to counties for services provided to Medi-Cal beneficiaries. As a result, counties have not been paid in a timely manner, and needed care has gone unpaid. We are leaving our counties at financial risk. AB 754 will clarify the obligations of state and local government and promote the efficient administration of the specialty mental health.
Excuse me just a moment. I'm going to ask that you take your conversations out of the room, please. Thank you very much.
AB 754 will clarify the obligations of state and local governments and promote the efficient administration of the specialty mental health managed care program. It's also intended to increase the timeliness of federal Medi-Cal payments to county mental health by reducing existing inefficiencies wherever and whenever possible. With me today, I have the California Mental Health Directors Association and Curtis Bauer from Colusa County to testify on behalf of the bill.
Madam Chair,
Thank you. The bill has been moved by Senator Strickland. Witnesses in support.
Madam Chair and members, it's on. I'm Kirsten Barlow on behalf of the California Mental Health Directors Association. The intent of the bill really is to increase administrative efficiency of the Medi-Cal mental health specialty program. Under this program, counties are the managed care plan for delivering Medi-Cal services for folks who need specialty mental health care. Under the program, counties are federally required to pay the full upfront cost of the bill. Should I wrap it up? Oh. I thought you wanted to move more quickly. Under the program, counties are federally required to pay the full upfront cost of the program for services to eligible beneficiaries. And then after the services are delivered, counties then claim to the state for federal reimbursement. I think Curtis has some really good examples of the real-world implications of how slowly federal funds have been flowing from the state to counties, and the sort of negative implications that has for our ability to run programs, to the extent that we oftentimes are now closing programs down for lack of cash flow. With that, I'll turn it over to Curtis.
Madam Chair and members, I am Curtis Bauer, Director of Behavioral Health, Mental Health, and Substance Abuse in Colusa County. I am here to urge your support of AB 754. With reimbursement delays on the part of the state, many mental health departments, county mental health departments, find themselves into their general funds. Colusa is into their general fund, $800,000. We are aware of some counties who are, just to keep cash flow going, are borrowing in excess of Colusa's borrowing. We pay back the general fund with interest, which is not reimbursable. Given the current state of situation of state and local budgets, the borrowing option is no longer going to be available to mental health departments. Local auditor and controllers are simply unwilling to let county mental health departments carry unreimbursed dollars from one budget year to the other. On July 28th, I go to my to my board of supervisors, went to my mental health board Monday night. We're in $800,000. Last week we received January's federal dollars. We have paid January through July, currently paying for services, and we simply can't carry the federal, waiting for the federal dollar for reimbursement. We've reduced our staff in April by 22%, and if our board asks us to come in line, more cuts are going to take place.
Thank you. Others in support, please state your name and that you are in support.
Juliana Voris with the Urban Counties Caucus in strong support of the bill. Thank you.
Farrah McDade Ting with the California State Association of Counties in support.
Judy Wolin with NAMI California in strong support.
Holly Fermini, Platinum Advisors on behalf of the Orange County Board of Supervisors and San Bernardino County Board of Supervisors in support.
Opposition, please.
Thank you, Madam Chair. Members, Stan Bajoran with the California Department of Mental Health. The department respectfully opposes this legislation, primarily for a couple of reasons. Number one, it does change significantly the claiming process for federal financial participation, and also there could be a significant impact to the state general fund because general fund cash is required to be advanced upon passage of the budget. This general fund impact could range from anywhere from about $185 million to $600 million. That's a general fund impact, but we believe the state can ill afford at this point. The other issue relative to claiming reimbursement for federal financial participation, the Department of Mental Health and the Department of Healthcare Services is working closely with the California Mental Health Directors Association and individual counties to improve the claiming process of not only general fund but of federal financial participation. We will have our new system up and running in March.
Thank you. So what are you suggesting to the author?
At this point, because of the possible cash flow implications and the huge change to the claiming process as it now exists, we must oppose the legislation.
And are you willing to continue working with the author and the sponsors, or is this just a flat no, just so I understand?
The Department of Mental Health is willing to work with California Mental Health Directors Association and the author to iron out our potential differences on this legislation.
Okay, thank you very much.
Well, needless to say, it's good to have the administration in agreement with your bill, so we will continue to work with the department. I do think that there is a response to the concern, and I'll ask the Welfare Directors Association to respond directly to if you don't mind, Madam Chair.
Yes, that would be fine.
Sure. I mean, I think on the first point related to the significant changes that the bill makes to the claiming process for federal funds, that really is the main purpose of the bill. Currently, the process is, I think our bill is really aiming to streamline the process. In fact, the Department of Finance OSA unit issued a report in 2007 that sort of outlined what the Medi-Cal claiming process is for federal funds and indicated that some of the invoicing that's happening between Department of Mental Health and Department of Healthcare Services is altogether not necessary, and that in some points in the process, electronic claims the counties submit and that DHCS sends to Department of Mental Health turn into a paper and pencil invoice that goes back and forth between the two departments before it goes even to the state controller to be paid. And so it's that very process we're trying to change. And so really the main provision in our bill of getting the federal funds to flow directly to counties once they've arrived into the state of California is really the whole purpose of our bill. And we think ultimately that will result in state general fund savings because fewer staff will be needing to do these archaic paper and pencil sort of invoicing processes.
Thank you. Senator Leno?
Thank you, Madam Chair. I want to commend you, Assemblyman. This issue repeatedly arises in our Budget Sub 3 committee hearings for Health and Human Services. And the state auditor has revealed to us that claims are paid sometimes in 96 days, sometimes in 109 days. This is an enormous hardship for counties. And so some reform is necessary. But I think that it is important to make note of the department's point regarding the requirement to allocate the full amount of contracted general funds at the beginning of the contract period. So you might want to keep an eye on that. That may be an issue for the Appropriations Committee. But otherwise, what you're doing is important.
Thank you, Madam Chair.
Thank you. And I move the bill.
Madam Chair.
Thank you. Senator Cox.
I too, Senator, have had several bills that has dealt with the payments, the aspect of our counties being the banker for the state of California. One of these days we're going to come into some money. And I do, in fact, believe it's a good time now to begin trying to work out the differences that we have from a technical standpoint so that when we do, in fact, have the money, we'll be able to do it on a timely basis. I wish you good luck. in getting the money released sooner. So far, I have not had that kind of fortunate results. But I do, in fact, believe one of these days we will have some money, and we will no longer ask the counties and other agencies to be the banker for the state of California. But at any rate, I think it's a great opportunity to work on all the details and the mechanics of how we do this when we do have some money.
Thank you. Any other comments from committee? Is there a motion?
There was a motion
Oh,
made
there was?
by Mr. Leno.
Oh, there was a motion by Senator Leno.
I did at the beginning. That's all right.
And at the very beginning,
I've heard three
in
motions,
the
but
very
no
beginning,
second.
we had a motion by Senator Strickland, my vice chair.
Oh, you need a second.
And Senator Negretti McLeod would like to add her motion. So now we have three. So we will, very, very briefly.
Yes, Madam Chair. First of all, I really appreciate Senator Cox's optimistic statement because we all need a little hope right now. But the goal here is not to have the general fund subsidizing the counties. The goal is to expedite the federal funds and get them into where they can do the most good at the county level and not have the counties subsidizing the general fund and the reverse of what finance is concerned about. So I hear a lot of sympathy there, and I appreciate for that problem. I appreciate the support, and I would urge your aye vote.
Thank you very much. We'll call for the vote, please.
Senator Alquist.
Aye.
Alquist, aye. Strickland.
Aye.
Strickland, aye. Onnested. Cedillo. Cox. Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Woke. It's got five.
That bill has 5 votes. It is on call.
Thank you, Madam Chair.
Thank you very much. Assemblyman De Leon. Item 7, AB 513. And he has a second one also. Welcome.
Thank you, Madam Chair, and I do apologize to you as well as the members of this committee for my tardiness. I was held up on several other
You're just fine.
committees. But Madam Chair, members, first of all, I would like to accept as author amendments, both amendments on page number 7 under commitments 2 and 4. We will continue to work with the Senate Health Committee staff to recraft the appropriate technical language, and I thank you, Madam Chair, Senator Alquist, as well as your staff for working with me and my staff with regards to these specific amendments, again, on page number 7. Thank you for allowing me to present and speak on behalf of AB 513, a measure which seeks to ensure that every new mother in California will have access to a certified lactation consultant and a breast pump. The Surgeon General, the American Academy of Pediatrics, the Center for Disease Control, the U.S. Preventative Services Task Force, and all major health organizations recognize that breastfeeding is one of the most important things a mother can do for her baby. Exclusive breastfeeding for 3 months has shown to reduce health care costs for infants in the first year of life alone by up to $475. AB 513 will ensure that HMOs and insurers cover the costs of quality breast pumps to help mothers continue to breastfeed after returning to work. This measure will also ensure that HMOs and insurers provide coverage for new mothers to see a board-certified lactation consultant to facilitate the breastfeeding process. This legislation is a crucial step to help all mothers who wish to breastfeed their children. I strongly believe that this measure will lower health care costs and, most importantly, keep both mothers and their babies healthier and happy. For these reasons, I respectfully ask for your aye vote. With me here today in support of the bill is Karen Farley, a registered dietitian, and an IBCLC, an international board certified lactation consultant for California WIC Association, and Meg Mark, the mother of 2. Madam Chair, as well as my esteemed colleagues on the other side of the aisle, I respectfully ask for your aye vote.
Thank you. 2 witnesses, 2 minutes each, please.
Chairwoman Alquist and members of the committee. My name is Meg Mark. I was able to breastfeed my 2 children only because I had professional help from an international board-certified lactation consultant. I had great difficulty breastfeeding my oldest son. Nurses at the hospital were unable to help, although they really tried. Our pediatrician was unable to help. We did not know where to turn. A friend gave me the name of an IBCLC. my husband and I were so relieved to finally have real help. I had to rent a breast pump to ensure my milk supply. After just a few weeks, all was going well. My family's HMO coverage did not provide a benefit for a consultation with a lactation consultant or a breast pump rental, and my family had to pay for these services ourselves. I am certain that it was only the professional care from my IBCLC that allowed me to breastfeed my baby. If my family had not been able to pay for these services, I would not have breastfed either of my children. AB 513 is needed to assist in providing lactation support when common problems arise in the early days and weeks after birth. If health plans provided this benefit, more babies would be breastfed for longer. Please support AB 513.
Thank you.
Madam Chair and Committee, my name is Karen Farley with the California WIC Association, and we support the work of WIC here in the state and at the federal level. And just to give you a couple of statistics, 87% of the women in California initiate breastfeeding in the hospital. So we know that a lot of women the majority of women in California decide they want to breastfeed their babies. As far as the WIC program goes, here in California, 60% of the babies are served in the WIC program. We're very proud of the services we provide. We have lactation consultants, peer counselors, trained staff, and breast pumps, but we need assistance. And just as Assemblyman DeLeon mentioned, the U.S. Preventative Services Task Force has scored breastfeeding, and it's being included in federal health care reform language, and it's got a very good score, and it advocates for a system-wide approach. So you may hear from the opposition that lactation consultants and pumps will not alone improve breastfeeding rates. We understand that. WIC has to do their part. The hospitals, the work sites need to be supportive, but we need this resource for women when they have common, normal questions and issues this early days and weeks postpartum. We also know that there's great health care cost savings. There's both acute and chronic diseases that can be prevented for moms and babies with breastfeeding. And the figures that Assemblyman DeLeon mentioned are just for a few of the lower cost acute problems, not to mention breast cancer and ovarian cancer, diabetes, and obesity. So for those reasons alone, we think that this, the numbers speak for themselves as far as needing this small investment for the long-term health care cost savings for moms and babies. We ask for your aye vote.
Thank you. Others, state your name.
Shannon Smith Crowley, American College of Obstetricians and Gynecologists, in support.
Thank you.
Charlotte Newhart with the Directors of Maternal, Child, and Adolescent Health and the California National Organization for Women in Support.
Thank you.
Kumar Chandran, California Food Policy Advocates, in support.
Thank you.
Nasim Zamani, California Commission on the Status of Women in Support.
Thank you. Others in support? Opposition, please.
You guys again?
Thank you, Madam Chair and members. Nick Luizos with the California Association of Health Plans. We do respectfully oppose Assemblymember DeLeon's bill. We believe it's well-intentioned, and our industry certainly recognizes the benefit of breastfeeding to the health of a newborn. That, of course, is not our underlying concern. And it is also why there is very extensive coverage for the lactation consultation services, as well as the related equipment when there is an underlying medical reason necessitating the use. We do think the bill is expansive and prescriptive, and together with other mandates increases the overall cost of health care and reduces our ability to design products that hit a price point that is affordable for employers and individuals. We would also just note that according to the independent analysis of the bill, utilization of services subject to this bill is not expected to change. This is because, as I mentioned, of the very extensive coverage already provided for these services, and the services is usually accessed only about once or twice according to the independent analysis, and there are other less expensive options than the private consultants that are specified in the bill. And the rental for the equipment subject to AB 513 is relatively low cost and not a barrier for access, according to the CHBRP analysis that was released on this bill. So we do oppose the bill based on those reasons. Thank you.
Jason Gappart with the Association of California Life and Health Insurance Companies. We are opposed to all the mandates. There still are, I believe, 6 moving through this legislative session right now, and CHBRP has estimated that the premium increases of those total would be about $164 million, and we just believe that the mandates reduce our flexibility to offer more affordable products to the individuals and employers that we sell our products to.
Thank you. If other witnesses could just state their name, please.
Natalie Cardenas on behalf of Anthem Blue Cross in opposition.
Sherry Lowenstein, Department of Managed Health Care in opposition.
Mark Brigade on behalf of the California Chamber of Commerce, also in opposition.
Thank you. Comments from committee? Is there a motion?
There is a motion.
Is there a motion by Senator Leno? Assemblyman De Leon, would you like to close, please?
Thank you, Madam Chair. I'll be... Sorry.
Were there questions? Or
Mr. Leno,
just
what do you make?
more who wanted to.
Color commentary?
Yes, thank you.
Question? I apologize, through the chair.
No, but we have 4 or 5 people who like to, make the motion. So we just are very happy committee here. Senator Negrete McLeod. Yes, go right ahead. Okay. Yes, and in closing.
In closing, Madam Chair, thank you for the opportunity to present this bill. This is a very important bill. I think when you get beyond the superficiality about the content, about breast pumps and breast milk, the bottom line is this. There's nothing healthier for a child than a mother's breast milk. Formula is not a healthy replacement for breast milk. I know there is some philosophical differences whether this should be a mandate or not. CHBRP came back with a mandate, which is roughly about $2.8 million. There was reference that was made about a whole slew of bills that are coming through the legislature on both sides of the aisle that total with a CHBRP analysis of roughly about $164 million in mandates with regards to CHBRP analysis. This right here is about $2.8 million CHBRP came back analysis across the state. We have a cost savings of $3.4 million. You do the math, it's about $600,000 cost savings in the state of California. I think if you want to have healthy babies and happy mothers, this is a very important measure. The bottom line is this: 64% of white women in the state of California exclusively breastfeed, 33% of African American women, and 32% of Latinas in the state of California breastfeed. There is a correlation when it comes to socioeconomics and whether one has health care or not. I believe this is a very important measure for women, in the state of California, and I respectfully ask for your vote.
Thank you.
Chair.
Senator.
Sorry. If it is possible, I would like to join you as a co-author.
I'd be so honored.
And I would also.
I would be honored, Madam Chair.
Thank you. We'll call for the vote, please.
Mr. Strickland? What?
Sorry.
No? Oh, okay.
Not at the moment. Not at the moment.
All right, okay.
Senator Alquist? Alquist, aye. Strickland? Strickland, no. Onnested? Cedillo? Cox? Cox, no. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negrete McLeod? Pavley? Woke? Woke, aye. It's got 3 ayes.
That bill has 3 votes. It is on call, and you have another item, file item 22, AB 1449.
Yes, Madam Chair. AB 1449 is a very simple, straightforward cleanup bill. It is a measure that's bipartisan. I thank you for the opportunity to present it. I would like to start off by accepting the suggested technical amendment on page 3 of the analysis as author's amendments. This bill simply clarifies the intent of AB 2569, which took effect this year, that the consumer protection provisions regarding agents, brokers, and sales representatives apply to those who are facilitating health care coverage on the individual market. I respectfully ask for your vote. Again, I want to underscore, emphasize, and underline this is a bipartisan measure.
Madam Chair, I'd like to move the bill. If you want to put my name as a co-author on this one, you're more than
I'd be more than happy
Right.
and deeply honored.
Thank you. Witnesses in support? Witnesses in opposition? Other comments from committee? The bill has been moved by Senator Negrete McLeod. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Aye. Strickland, aye. Onnested? Cedillo? Cox? DeSaulnier? Leno?
Aye.
Leno, I. Maldonado? Negretti McLeod? Negretti McLeod, I. Pavley? Woke? Woke, I.
Looking here. That bill has 5 votes. It is on call.
Thank you, Madam Chair. Thank you. Good day. Thank you, Mr. Strickland. Thank you.
I think Assemblywoman Brownlee is next. This is file item 11, AB 627. Welcome.
Thank you, Madam Chair and members. According to the Centers for Disease Control and Prevention, 1 in 4 children between the ages of 2 to 5 are considered obese, putting them at risk for health conditions such as type 2 diabetes and hypertension. The state has established nutritional standards for our K through 12 system, but we really need to start at a younger age. With so many kids in child care settings can play a critical role in shaping healthy habits. This bill establishes a minimal nutritional standards for licensed child care. These standards are not difficult to meet or costly to implement and were a result of an almost 2-year process initiated by the Superintendent of Public Instruction and the Health and Human Services Agency looking at how to reduce childhood obesity. This bill also establishes a pilot project to determine how best to implement even stronger nutrition and physical activity standards and is implemented only if general fund dollars are identified for this purpose. This pilot is similar to the pilot project that was done prior to the implementation of the K-12 standards. I want to point out that the Department of Finance's concerns noted in the analysis was based on a prior version of the bill. The piece finance indicated may result in cost pressure is no longer in the bill. We amended it since then. Instilling healthy habits at a younger age can help prevent absences in school and in the workforce. This is a small step that will hopefully have a long-lasting impact. I have with me Dr. Lorraine Ritchie, who's the Director of Research for UC Berkeley Center for Weight and Health, and Ken Hecht with the California Food Policy Advocates.
Thank you, Madam Chair and members. As a researcher who has devoted her career to child nutrition and obesity prevention, I'm extremely pleased to see this long overdue attention to early childhood. Obesity is increasingly affecting our nation's youngest children. Obese preschoolers are at high risk of growing into obese adults, an obesity that is extremely challenging to reverse. And early childhood is an ideal time for obesity intervention because habits and tastes at this age are less ingrained and more amenable to influence than at older ages. Recently, we completed a large statewide survey to examine the foods and beverages served in licensed California child care homes and centers. This study involved over 400 child care sites representing data from approximately 32,000 children who are preschool age across the state. A second observational study in Los Angeles confirmed these findings, and I'd like to share a few of our results with you. First of all, child care sites that participated in the federal food subsidy program known as CACFP served higher quality foods and beverages than sites not participating in the program. However, even sites participating in this program could benefit from improvements. Food from home occurring primarily in non-CACFP centers had the lowest quality, and the most common shortfalls were water, low-fat milk, vegetables, and excessive fat and sugar. And just as a few examples, less than a third of child care sites served water at meal and snack times. Instead of low or non-fat milks, 20% of child care sites served whole milk to children over 2 years of age. And fewer than recommended amounts of vegetables were served, and in many cases, the vegetables that were served were fried potatoes. In conclusion, there is scientific consensus that interventions are needed to improve early child nutrition, and AB 627 responds precisely to the problems that we documented in our studies of California child care.
Thank you. Next witness, please.
Ken Hecht, representing California Food Policy Advocates, the bill's sponsor. In light of the very thorough analysis of the bill and two wonderful people testifying before me, I want to say only two more things. One, part of this bill goes to licensing and to use licensing as a way to start to get at some of the solutions to the problem of obesity in very young children. There are 24 other states that have done that. We're on very safe ground in proposing this. Second, the other part of the bill has to do with a pilot, which would take effect only if there are non-state funds for its operation, and it provides California with an opportunity to test out some of the more experimental and some of the more expensive improvements to nutrition for children that would be of great interest to USDA and the rest of the country. So it gives us a chance to get back into the leadership in this very important area. Thank you.
Thank you. Others, please just state your name.
Nicole Wertelman on behalf of the City and County of San Francisco in support.
Charlotte Newhart, in support by the Directors of Maternal, Child, and Adolescent Health in the counties.
Kathy McBride for the Superintendent of Public Instruction, Jack O'Connell, in support.
Brendan Tuig on behalf of the California Center for Public Health Advocacy and support.
Kathy Mossberg on behalf of Tom Riley, who had to leave, want to express the strong support of the American Academy of Pediatrics.
Opposition?
Madam Chair, members, Ralph Simoni representing the Grocery Manufacturers of America. As noted on the analysis, we are opposed unless amended. We have no problem with the overall policy of ensuring proper child nutrition in daycare settings, but some of the criteria that's used does need a little bit of work. And I would cite you specifically to page 4 of the bill, lines 17 and 18, that deal with the sugar requirement. And I'll read it. It's very brief. Sugar shall be limited to 6 grams per serving for both hot and cold cereals. Now, this raises several questions. The first one, for example, is what is per serving? There's no metric to tie it to. Are we talking about a cup, an ounce, a gram, whatever? We have had a dialogue with the sponsors and the author's staff. Perhaps we could tie this to the per serving specified on the cereal package. That might cure that. The other issue is using 6 grams per serving. As we are informed by the proponents of this bill, it was taken from the WIC standards. And as this committee is aware, WIC standards apply to children under 5 years old.
It's getting a little noisy again, and I really can't hear everything that's being said. So if you have conversations, you're more than welcome to have them, but you have them outside the door.
Thank you. As I was saying, the 6 grams was borrowed supposedly from the WIC standard, which applies to children of 5 years and younger, and that meet certain nutritional requirements. When I looked up the definition of child and child care facility in the Child Care Facility Act, the ages can go to anyone up to the age of 18. So, and I'm not suggesting that there are many 18-year-olds in child care facilities, but the WIC standard is up to 5 years. You may have 8, 10, 12, 14 years old in a daycare or an after-school setting, and at some point we have to ensure that 6 grams is the proper metric. We're not certain at this point that, in fact, it is. So we would like to, our amendments are intended to ensure that manufacturers know what products can be served in California daycare facilities, as well as daycare facilities having an easy yardstick to ensure their compliance.
Thank you, and I'm very supportive of the bill, and I would also like, Assemblymember, if at some point, if you can address the concerns that were just raised. So, are there questions from committee? Assemblymember Brownlee, and if you could also address the... Senator Leno.
That was
that was your question too, and yes,
Okay.
so...
Thank you. My nutritionist here might have an answer as well, but we certainly want to work with the grocery manufacturers on this. This has just come to our attention, and we will work with them. Certainly, we think that we already have a solution with regards to the appropriate metric with regards to either weight or as specified by the manufacturer on the label of the product. The other issue around whether 6 grams is the proper metric, I think we believe that there's a policy rationale for that and research that substantiates that. WIC has the 6 grams. We believe that actually WIC, standing for women, infant, and children, that it applies to a broader age range, and feel like that there is nothing really wrong with limiting sugar for older children in this particular case. But having said that, we really will continue. Again, we've just this issue's just been raised, and we will continue to work with them.
One thing you're specifically going to work on is about the implementation of the sugar standard.
Correct.
Because it does not conform to WIC currently, and that's one piece you're going to work on to clarify.
That's correct. We do believe that the 6 grams is the WIC standard. But in terms of how to implement that, yes, we will work on that.
Thank you. And Senator Leno has a comment.
I just wanted to say that I'm very supportive of the bill, and I think it's a very creative fashion in addressing the epidemic of childhood obesity and related type 2 diabetes that is before us. 1 in 8 Californians currently experience type 2 diabetes, and we all know the serious health implications to that. But a child born today has a 1 in 3 chance. So we're going to go from 1 in 8 to 1 in 3 in the next 25 years. And this is a preventable disease. Additional 7 to 15 pounds on a child could double his or her likelihood of type 2 diabetes. So to the degree that we, as the witness suggested, address this the earlier, the much better. And it is preventable, but if we don't do something, or probably more than something, do multiple things and address it from different angles, this is a very important one, our healthcare system, which is already teetering, is going to be completely run over by this epidemic. And there's even a prediction that by 2050, if we don't do some significant changes in our eating habits, every other Californian will have type 2 diabetes, which is just unimaginable and preventable. So good work.
Thank you. Thank you very much. And I'll take that as my close.
Well, thank you. I know in my nuclear Greek family, my parents and my only sibling, I am the only one who does or did not have type 2 diabetes. Did not have diabetes, period. And it affects all ethnicities. And it's certainly something that when I was a young mother, I didn't really know about. But thank goodness things have changed tremendously since then, and it's something we want all people to understand, and we want to help our children. So with that, and see there's been a motion?
Yes.
By Senator Leno. We'll call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Strickland, no. Onnested? Cedillo? Cox? Cox, no. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? Has 3 aye votes?
That has 3 aye votes. It is on call.
Thank you very much. Thank you.
Next, we have Assemblymember Delatorre, file item 10, AB 591. Welcome.
Thank you. Yeah, this is easy. Thank you, Madam Chair and members. I'd like to start off by addressing the committee's suggested amendments. I will accept the committee's suggested clarifying amendment on page 5, number 3, which seeks to add language on the health identification card, clarifying when it is appropriate to call the regulatory agency. On the second suggested amendment on page 5, number 4, which clarifies the dates in which the plans and insurers must apply, I am offering amendments today addressing the committee concerns. The mock-up provided extends the date in which plans may issue new cards beginning January 1st of 2010 to July 1st, 2010, or upon annual reissuance of new cards. They have their own time frames, and whenever those happen, they would include it on there. I believe this allows adequate time after 2 open enrollment periods to incorporate the information on the health information cards provided to consumers. The bill itself has received bipartisan support in the Assembly and the Senate. There are 2 parts to the bill that will protect consumers. The first part is not related to health. It's a deterrent that increases the penalty from $1,000 to $5,000 for paying or receiving a kickback in referring a consumer to services or goods for which a car insurer reimburses. That's not health insurance. And in the second part, the second ensures that information about health plans and health insurers is readily accessible by consumers. A consumer cannot receive information if they only have the marketing name, because both DOI and DMHC only keep track by a number that they have internally. So if you call in as a consumer and say, I have such and such healthy plan, they don't know what you're talking about because they don't have the name, the marketing name. They only have the number. The consumer has no way of knowing the number, so it's a ridiculous catch-22. So basically, the bill says that they have to have the marketing name, and then that the consumer gets the phone number for DOI or DMHC, whoever regulates that plan, on their card, so that they can call if they have some kind of a grievance after they've completed the internal appeals process within that insurance company. Just a very simple consumer clarification. And with that, I'd urge your support for this measure.
Thank you very much. Witnesses in support?
They're not here today.
It is. We'll pass it around. Witnesses in opposition? It's opposed by the Department of Managed Health Care. Oh, right, and there are others.
Now everybody
in
else
addition,
is coming.
yes.
They're just piling on.
Well, I guess they didn't get their letters in time.
No, Madam Chair, I believe this is because the amendments created the opposition.
Oh, okay. So that's because the amendments created the opposition. Thank you. All right. 2 witnesses, 2 minutes each.
Sherry Lowenstein with the Department of Managed Health Care. I just want to clarify, we were opposed to the previous version of the bill. The current version of the bill are with the amendments. I have no comments on the benefit card portion because we haven't reviewed that yet. But on the original portion dealing with the marketing name, we frankly don't see any consumer benefit, and I want to clear up some confusion that the Assembly members mentioned about how we intake information with, if somebody calls with the marketing name or a number or how things happen. It's not a matter that we keep things in terms of a number or a name. When somebody calls our help center, we get from them information that's specific to their particular contract so that we can evaluate their particular issue, contact the health plan. We will always have to contact the health plan to get a response from them with respect to the consumer's particular issue. We always collect certain individual information from that consumer to be able to ensure that we put them with the right product, the right plan, etc. The information that's being requested is not going to assist us in that process whatsoever, and as far as we can tell, is not going to assist the consumer.
Thank you.
Thank you, Madam Chair and members. Nick Luizos with the California Association of Health Plans. We do apologize that we did not send a letter to the committee or to the author. We did not oppose the previous version of the bill. We do oppose the amendments that are being advanced by the author. We do believe that they will result in significant expense to our health plans to reissue the ID cards and recreate them, excuse me. We also feel that the bill is duplicative and will cause some confusion and frustration among our health plan enrollees. And the reason that we believe this is because in the vast majority of cases, health plan enrollees are required to exhaust the health plan grievance process before a grievance process is initiated with our regulator, the Department of Managed Health Care. And as a part of this process, plans are already required under existing law to provide enrollees with the DMHC Help Center's phone number and on any grievance denial and other documents, including information about independent medical review. Specifically, health plans under the statute, and if the chair will indulge me to read specifically from the statute, health plans are already required to provide this information on every evidence of coverage, so every EOC, on copies of plan grievance procedures, on plan complaint forms, on all written notices to enrollees required under the grievance process of the plan, including any written communications to an enrollee that offer the enrollee the opportunity to participate in the grievance process of the plan, and all written responses to grievances. So we think that the consumer protections in statute are very thorough. Printing new ID cards will be an added administrative cost to our plans. We believe it will also confuse and frustrate enrollees by having both plan information and regulator information on our cards. Because, as I stated earlier, the health plan internal grievance process is typically required to be conducted before our regulator is involved in those issues. So the employee may waste time or feel like they're being batted back and forth between the plan and the regulator. I would also just mention our industry just removed its opposition to Senator Lowenthal's SB 296, which included similar issues related to health plan ID cards. And our national trade, I should say, AHIP, worked very hard in securing those amendments. And the bill is inconsistent with some national standards that many of our multi-state companies are working to achieve. So we oppose the bill for those reasons. And again, apologize for not having the letter.
Thank you.
Jason Gappart with the Association of California Life and Health Insurance Companies. And we also apologize for not having a letter in, but we are opposed to the amendments.
Dan Chick with HealthNet. We too are opposed to the amendments. Due to their late nature, we're still trying to figure out the cost, but we think they are sizable, and we think that the requirement is redundant. Thank you.
Thank you.
Natalie Cardenas on behalf of Anthem Blue Cross, and I concur with the comments of my colleagues, and we will get our letter in momentarily.
Thank you.
Joe Crescione on behalf of Western Dental Services. We have about 600,000 members for whom we would have to do this, and we calculated the cost at about $1 each at a minimum. So we'd spend in excess of $600,000, and we think it'll cause a lot of confusion because the member typically, having seen the number, they would call the department first.
Thank you. So I guess you're opposed?
We're opposed, yes.
Okay, thank you. Comments from committee? Is there a motion? It's been moved by Senator Leno. Assemblyman Delatorre, if you have a brief closing.
Yes. In reference to the Lowenthal legislation, that is specific to mental health, not to the broad array of health issues, number one. Number two, it says nothing about the regulatory agency that regulates that policy. I have here my card for my insurance company. It's got all kinds of information. It's got my doctors. It's got my kids' doctors. It's got in case of emergency. It's got for urgent care numbers on there. Evidence of coverage book refers you to the evidence of coverage booklet. There's a whole half a card here that's empty. So I think it would be very easy for them to put in a phone number.
We have a late question by Senator Cox.
Madam Chair, the Assemblyman is showing us his health card, but he's not showing us the booklet he also received when he got his health card, outlining the grievance procedure that's available to him in the event that a claim is denied. It's really a two-part kind of situation, one of which is the card that you carry in your pocket, and all of us carry one, so that when we go to the physician or hospital or clinic or whatever, they ask to see our card. But they also provide you with a booklet when you became a senator or an assembly person. The people that enrolled you gave you your card, came to you, and you also got a booklet. Now, I don't know what the Assemblyman did with his booklet, I can tell you, I don't know where my
What'd you do with yours?
Well, I will tell you, I put my booklet in the file cabinet next to some important papers so that if I had a dispute with the insurance company, I could go to that and find out who I needed to call. I just wanted to be certain that the Assembly recognized that he got all the material that was necessary. And that, in fact, for all intents and purposes, complies with the request that he's making.
Well, thank you, Senator Cox, and it's good for us to know where you're keeping yours. And we will now let Assemblymember Close.
I will just give you one example that happened to me within the last week. My oldest daughter broke her foot. She broke her foot at a park. My wife went and picked her up and took her to urgent care to have x-rays. Where in that time frame was my wife supposed to go get the booklet? So, again,
we are now letting the Assemblymember Close. Respectfully, I say that to you, my friend.
The issue is the state regulatory agencies are ultimately responsible to the public. That's why it's there. And so they are the linkage for the general public to their insurance company if the grievances or whatever the process is doesn't work out. So the simplest thing we can do, there's only 2 regulatory agencies, is to use their phone number and put it on these cards. There's room for it. It's a simple task, not $1 a person, because these cards get cranked out during open enrollment period a couple times a year. So it's not that onerous to them. I think as a government entity, we need to be responsive to the consumers. That's what this bill does. I urge your aye vote.
Thank you. The bill has been moved by Senator Leno as amended to appropriate, and we will call for the vote now.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox?
No.
Cox, no. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke. Let's go.
That bill has 4 votes. It is on call. Thank you. This is between Assemblymember Jones and Assemblymember Block. I know that Assemblymember Jones has 4 bills and Assemblymember Block has 1 bill. And Assemblymember Jones is first on the list.
Welcome. Thank you, Madam Chair. Senators.
You're welcome. And this is your first bill. File item 13, AB 786.
Thank you very much, Madam Chair. Senators, AB 786 is designed to provide transparency in the individual health insurance market and would eliminate insurance products with an out-of-pocket maximum in excess of $10,000 annually. Over 2 million Californians buy health insurance in the individual market. It's an important part of our health insurance market. And of course, this committee and our committee in the Assembly spent a great deal of time making sure that market functions as it's intended. This bill is intended to protect those consumers who buy coverage as individuals by eliminating insurance products that have no out-of-pocket maximum. Without an out-of-pocket maximum, individuals find themselves potentially facing unlimited financial exposure that they might not fully appreciate when they buy a policy. The bill also provides that the Department of Insurance and the Department of Managed Health Care would categorize all the remaining products into no more than 10 categories that would allow consumers a better opportunity to compare products on an apples-to-apples and oranges-to-oranges basis within each category. The committee heard last year from Susan Bragg in the context of Senator Steinberg's SB 1522 she faced tens of thousands of dollars in bills for breast cancer treatment, even though she bought health insurance, because in that case, that insurance did not cover those very treatments. So one of the important things this bill does also is to standardize terms and definitions to make sure consumers have a better understanding of what they're purchasing. We've got ongoing negotiations with the industry, and I want to thank the plans and the health insurers for sitting down with me and continuing to negotiate about the content of the bill. We've taken a number of amendments. I know that we have not completely removed the opposition, and I look forward to continuing those discussions in a productive fashion to see if we can resolve all of the concerns that have been raised. We were provided just recently new language by the Department of Managed Health Care, and that language you see incorporated in the bill in print before you today. So we continue to hope to have the opportunity to make progress. Given the timing of the committees, we are not able to take amendments today with the permission of the chair, but we do commit to incorporating the technical amendments, the very thoughtful and helpful technical amendments laid out in the analysis, into the bill at the next opportunity when we take amendments.
Thank you, and we appreciate that. 2 witnesses, 2 minutes each.
Good afternoon, everyone. My name is Martha Yvonne Fadlin, and I live in San Jose. I'm a licensed vocational nurse. Last year, at the age of 62, my hours were cut from part-time, full-time to part-time, and with that went my insurance. So I was forced to buy insurance on my own. I called Blue Cross, I called Blue Shield, I called Kaiser. They were all lots of money. Then I saw an advertisement of health insurance on the TV from a company called MultiPlan based in New York. The premium was $268, and it offered all benefits I needed: hospitalization, emergency room, x-rays, mammogram, and lots more. It sounded very well. I thought I had a good insurance until I got sick last November with diverticulitis. I went to see my doctor in severe, unbearable pain on the left side of my abdomen and was referred to the emergency room at Good Samaritan Hospital. I had some tests done and was given a prescription and sent home. A few weeks later, I received bills totaling over $10,000, of which MultiPlan played a very little portion. Now I owe Good Sam $8,000 for tests I thought were covered by my insurance. When MultiPlan said they covered x-rays and labs, I believed them. It never occurred to me that an insurance company could say it covered something but only pay a tiny fraction of the cost, like $100 on a $10,000 bill. How is that coverage? If I had known, I would have never bought it. As an American, I deserve better. Please pass AB 786 to better label products about what they cover and don't cover, to stop companies like MultiPlan from tricking people in buying junk insurance. Thank you.
Thank you for coming. Next witness.
Beth Capel on behalf of Health Access California. We're the sponsors of this measure, as we were the sponsors of the Senator Steinberg's measure last year. I think a number of us remember Susan Bragg, who was another Californian who had done the right thing, bought health insurance. Like Yvonne, thought she had gotten coverage that was meaningful, and discovered when she had breast cancer that none of her treatment, not her chemotherapy, not her lumpectomy, virtually none of her treatment was covered. We had another witness earlier this year who lives in Chico, who had bought, again, a woman who had bought insurance and thought she had coverage until she was bitten by a rattlesnake while clearing out her backyard and ended up in the hospital, $73,000 bill, of which the insurance covered $2,000. There are too many of these stories where people think they've bought meaningful insurance and it turns out they haven't. This bill is a fairly modest step. It's a more modest step than the bill you had before you last year. It sets a maximum out-of-pocket cap of $10,000. It standardizes terms and definitions, and it also then categorizes into 10 different categories. We have worked at length with the plans and insurers, as well as with the administration. The language that Mr. Jones reflected incorporates much of what the administration has suggested, although I don't want to represent it as their language exclusively, and we commit to continue to work with them to finally get Californians protections that they deserve. Thank you.
Thank you. Thank you. If the other witnesses would like to state their name, please.
Elizabeth Landsberg with the Western Center on Law and Poverty in support of these standards.
Gary Passmore with Congress of California Seniors, urging your support for this minimal, modest bill. Thanks.
Vanessa Gahina with the California Immigrant Policy Center here in support.
Mike Egan on behalf of the California Teachers Association in support.
Randy Hicks with Californians for Disability Rights in support.
Ed Guzman on behalf of California Alliance for Retired Americans, and we're in support.
Judith Larson on behalf of Jericho, a Voice for Justice, in support.
Shannon Smith Crowley, American College of OBGYNs, in support.
Witnesses in opposition, please.
Thank you, Madam Chair, members. Natalie Cardenas on behalf of Anthem Blue Cross. We appreciate greatly the work that the author has taken and the sponsor. This bill has come a long way from what it was in the Assembly. However, there remains several points of issues that have yet to be resolved. So at this time, we are unable to remove our opposition. Get to those points just now. First off, the bill would require the out-of-pocket maximum at $10,000. Currently, it does not allow for a adjustment factor based on the consumer price index, the medical component thereof. We have asked for $15,000 out-of-pocket max with an exemption for pharmacy and specialty services and the indexing. That would be something we would be okay with. The bill does not do that at this time. The bill would require us to charge more for products. We do have products that have an out-of-pocket max in excess of $10,000. So those folks, about 125,000 of our enrollees, would be forced to buy up or go without coverage at all. In addition, the bill requires regulators to develop standard terms and definitions for things in the marketplace. And we believe that that would be excessive administratively burdensome for both us and for the department. And at this time, we think that with the budget as it is, that would be extremely costly. And we are also concerned with the vagueness of the language, that such a regulatory process would be very broad and could incorporate definitions and terms that would further limit coverage and increase costs for products in the marketplace. And finally, in the bill as it is today, there is a notice for products in the bottom tier that we believe is just overly aggressive. We believe that it may not even be accurate for some of the products that end up in that bottom tier, and we just think it's completely unnecessary. We thank the author again for the efforts taken thus far. Unfortunately, they're not enough for us to remove our opposition at this time, and we remain opposed.
Madam Chair, members, Stephen Lindsay with the California Association of Health Underwriters. I represent licensed insurance agents who market and service these products. And we have concerns in two areas. The first one is the out-of-pocket maximum cap. We are opposed to a cap, and that's driven by two different things. One is that we believe that some insurance is better than no insurance, and nobody to date has proven to us that they can actually control the increase in healthcare premiums or healthcare costs. So what happens for my members is when one of my low and moderate income members bumps up against that, they end up with a 15% raise. I have nowhere to take them. They're stuck. and at some point they will eventually drop coverage. So we think this, however well-intentioned it is, truly discriminates against low and moderate income folks who are actually doing the right thing by buying coverage. The second issue that troubles us is the bill requires the plans to be put in categories based on an actuarial value. And in the world that I come from, there's about 136 individual products. And I could have a product with a $7,000 out-of-pocket maximum and one with a $4,000 out-of-pocket maximum, and they could be actuarially equivalent, depending upon how the rest of the benefits inside the products are arranged. And so we think that's the wrong standard. We think we need to spend a whole lot more time talking about this. My members, and myself included, I've spent our whole careers learning how to explain benefits to folks. And an actuarial equivalent is not a way to explain benefits to folks. All it does is confuse them. So while we're not opposed to what they're chasing in terms of being able to compare across categories, the way that they're choosing to do it, we think, will create more confusion and more problems than it actually solves.
So in a sentence, what would you suggest? Or two?
Well, we had conversations the other day. When I think about how folks, the things that are of importance to folks when they buy a policy, which is the deductible, the co-insurance, the out-of-pocket maximums, and the premiums. Those are the things that people focus on. And so we think there's a better way to structure those in a way that you can categorize all those products rather than using an actuarial equivalent.
Thank you. Other witnesses, state your name, please.
Mark Brigad on behalf of Cal Chamber, also opposed to the bill.
Jason Gappart with the Association of California Life and Health Insurance Companies, in opposition.
Joe Krishonian on behalf of Western Dental Services. We're not here in opposition. We're here to just hopefully clarify that.
We've had the two witnesses in opposition. If you could just state that you were opposed, please.
We're not opposed. We're just asking for the dental plans not be included in the portion of the bill that deals with the maximum annual cap.
Thank you.
Thank you.
Hi, Dan Chick with HealthNet. We are opposed.
Charles Baca with the California Association of Health Plans in opposition. Thank you.
Thank you. Comments from committee? Is there a motion? The bill has been moved by Senator Pavley. Assemblyman Jones, if you would like to close, please.
Thank you, Senators. I think we are not including specialty insurance products. I think there was a fair summation of the differences in views here, and we are continuing to try to see if we can reach agreement. On some of these issues, there's actually a difference of opinion within the industry. On others, there's not. And my goal continues to be to try to see if we can bridge these gaps. On the point about using actuarial equivalents, there's some disagreement amongst the industry on that point, but I do want to note that in the bill itself, on the OPA website, the information about deductibles, co-payments, services, benefits will all be there for the consumers to see, and so they won't be making decisions solely or even significantly on actuarial value. They'll be making decisions based on a complete package of information and an ability to compare apples to apples. So we would ask for the committee's permission to be able to continue moving the bill forward and an opportunity to continue to work with all the stakeholders.
So you've moved the bill. So the bill has been moved by Senator Pavley. We'll call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox? Cox, no. DeSagne? Leno? Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Aye. Pavley, aye. Woke.
That bill has 3 aye votes. It is on call. Assemblyman Jones has 3 more bills.
That's too many.
Okay.
It's just today.
You want to do something about it or what? Okay.
Let's not go there.
Right. It's going to be file item 18, 23, and 24. So file item 18, please.
And I apologize, I don't have the file.
And that's AB 1076.
Very good. Thank you, Madam Chair. Members, this is a two-part bill that seeks to approve two existing pilot projects in the Medi-Cal fee-for-service program. The first part would require the Department of Health Care Services to redefine the existing case management program to include beneficiaries who meet additional criteria. These criteria would include having 2 or more chronic conditions, not being enrolled in managed care, not being eligible for Medicare, having received emergency services on 4 or more occasions in the previous 12-month period, and concurrently seeking care for a condition that could have been prevented with timely primary care access. The essence of this is to try to build on the Medi-Cal case management program to address the health care and social service needs of what have been variously described as frequent users of care by linking these individuals with community sources of care and social service agencies, and to make more of these individuals eligible for this particular pilot program. The second part of the bill deals with the Medi-Cal disease management program, and it would include the designation of the primary care provider as the patient's medical home. This committee and our committee has heard from quite a number of expert sources about the importance of establishing a medical home. There does seem to be a consensus with regard to trying to move the state in that direction. This takes a small step in the context of the disease management program in trying to establish a medical home for the participants in that program. We're very happy to take the technical amendments as authors' amendments that were identified in the analysis, and we're very happy to have the chair as a principal co-author of the bill. We do have some witnesses in support, Madam Chair.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty in support. Before starting at Western Center, I was an advocate at the Legal Services Program here in Sacramento, and remember well one of my clients who had mental health disability, numerous chronic health conditions. He came to me for a dental problem, but in the course of talking with him, I asked him if he had a primary care doctor. And he said, oh no, I just go to the emergency room down at UC Davis when I have a problem. So this is really the type of person we're trying to address here with some of the frequent users and medical home models to try to help people establish themselves with a clinic or with a primary care provider to meet their needs. We think it's good for consumers in making sure they get appropriate care and also can save the state money from avoiding unnecessary emergency room use. Urge your support. Thank you.
Next witness in support.
Big Husband, support for the California Alliance for Retired Americans from Orange and support.
Thank you.
Judith Larson on behalf of Jericho Voice for Justice in support.
Thank you.
Allison Ramey on behalf of the California Primary Care Association, representing over 800 community clinics and health centers in support.
Thank you. I understand there's no opposition, but is there any opposition? Comments from committee? The bill has been moved. Is it amended? Do pass as amended by Senator Negrete McLeod. Assemblyman Jones,
Just ask for your aye vote, Madam Chair.
Thank you very much. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox? Cox, aye. DeSaulnier? Leno? Maldonado? Negrete McLeod? Negrete McLeod, aye. Pavley? Pavley, aye. Woke. It's got.
That bill has 4 votes. It is on call. Next, we go to item 22, AB 14. No. I'm sorry. File item 23, AB 1541.
Thank you, Madam Chair. This is a committee bill that simply conforms our state health insurance law to changes that were made in the Children's Health Insurance Program Reauthorization, or CHIPRA. We're very pleased to accept as authors amendments, those described in pages 5 and 7 of the analysis. CHIPRA allows an individual to enroll in coverage under a group health plan not later than 60 days. California requires that they enroll within 30 days. We'd be conforming our law to the 60-day requirement of the federal government. There's no opposition. We do have witnesses who'd like to testify in support.
Vice Chair, move as amended. Support on both sides, just so.
Great. Mr. Chair and members, Terry Calgar-Hill on behalf of the 100% campaign in Pico, California. We are in strong support of this measure, which will allow kids who lose health care coverage additional time to access private health care coverage. We urge your support.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty and Support.
Thank you. Witness opposition? No witness opposition.
Move the bill.
Bill's been moved. Senator Pavley and Secretary, call the roll.
Senator Alquist, Strickland.
Aye.
Strickland, aye. Onnested, Cedillo, Cox. Cox, aye. DeSaulnier, Leno.
Leno, aye.
Leno, aye. Maldonado. Negretti McLeod.
Aye.
Negretti McLeod, aye. Pavley.
Aye.
Pavley, aye. Woke.
That bill has 5 aye votes. Remain on call.
Thank you, Mr. Chairman.
Assemblyman, you have file item 24, AB 1544.
Yes, sir. Members, we're very pleased to take the clarifying amendments in the analysis proposed by your committee staff. This bill is about streamlining and reducing the impediments to hospitals' establishment of primary care clinics. One of the things that I know that this committee is aware of, and my committee is very well aware of, is the increasing, crushing burden of individuals seeking care within our emergency rooms and emergency departments. Clinics provide an alternative. This bill would simplify the process for hospitals to establish outpatient clinics. We continue to be in discussions with the Department of Public Health on the bill, and those have been very productive, and we would ask for your aye vote.
This bill has been moved as amended by Senator Cox. You have support on both sides, so please,
we do have some witnesses in support.
Please.
I'm Charlotte Parker, and I represent Colusa Regional Medical Center, which is a small rural hospital in Colusa County. It is the only hospital and has been there 130 years, serving 22,000 inhabitants. Recently, in the last 3 years, they had the opportunity to take over a clinic that had closed, to move 2 clinics to larger locations because they were at capacity, and to remodel a clinic that had been closed because of a roof caving in. The least amount of time it took to do that was 9 months. So it took from 9 to 18 months to simply remodel or relocate, in one case, 2 blocks of clinics because they had reached capacity. 70% of the patients who seek care there are either uninsured or Medi-Cal or Medicare. The average cost to operate one of those clinics is $2,000 a day. The average clinic is open 20 days a month. That's $40,000 a month that this small nonprofit 501c3 had to absorb in order to try to meet the needs of the community. That is an example of why this bill would help really speed up the process so that these small rural hospitals don't have to absorb somewhere between $350,000 to $450,000 in order to have a clinic ready to be licensed. Thank you.
Next witness in support.
My name is Gail Nickerson. I'm the Director of Clinic Services for Adventist Health. We have the largest rural health clinic system in our state and an equal number of non-rural health clinics that are hospital-based outpatient clinics. Unlike primary care clinics, in order to add a clinic to our existing hospital license, we have to wait on a DPH survey. Even moving an existing clinic requires a licensing survey. The amount of time that it's taken for us to get surveys for these clinics is frequently unacceptable. We've waited 5 to 9 months and even more for surveys. This is new buildings or remodeled facilities that are standing empty a long time while we're waiting. Sometimes we're even paying facility expenses on 2 locations while we're waiting for this to happen. All of this increases the cost of care. Sometimes we are required that we open the clinic and then wait for a survey that we don't even know when it's going to come, which is causing us to write off a lot of expense for things we can't bill. So I just want to say we're hospital departments. Our clinics are held to very high standards of Joint Commission as well as CMS. Our bill is only seeking parity with the community health centers that have already been authorized to open new sites under similar conditions. We're very knowledgeable and experienced in provision of safe, high-quality care, please help us to meet our goals of expanding access to care in our communities.
Next witnesses for identification purposes only.
Cherie Kruckenberg, California Hospital Association in support. Thank you.
All right. Any opposition? No opposition? Oh, opposition. Please.
Hi, Jennifer Simoes, Department of Public Health. The department has an opposed approved position on this bill. However, we are working with the author's office and the sponsors, and some of the amendments in the committee analysis will take care of some of our concerns, and we will continue to work with the author's office and the sponsors.
The bill, and if you conclude committee staff in those discussions, that would be helpful.
Yes,
Thank you.
we will. Thank
The bill's been moved by Senator Cox. Secretary, please call the roll.
Senator Alquist. Strickland. Aye. Strickland, aye. Onnested. Aye. Onnested, aye. Cedillo. Cox. Aye. Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod. Aye. Negretti McLeod, aye. Pavley. Aye. Pavley, aye. Woke. Aye. Woke, aye.
That bill has 7 aye votes and will remain on call.
Thank you, Mr. Chairman. Thank you, Senators.
Assemblywoman Ma. Members, file item 8, AB 517.
Good afternoon, Mr. Chair and members. I would like to start by accepting amendments noted in the analysis by committee staff with some adjustments and additions which should have been distributed yesterday. Assembly Bill 517, the Safe Body Art Act of 2009, provides statewide standards for the regulation of the business of tattooing, body piercing, and the application of permanent cosmetics in California. More than 10 years ago, AB 186 established regulations but lacked enforcement guidelines. Since the passage of AB 186, the number of body art facilities has increased fourfold. Only 6 cities and counties currently have a comprehensive program that regulates or inspects practitioners and facilities. Current law does not provide adequate regulation over the backstreet tattooing and piercing in unsanitary facilities and by unregistered practitioners. The lack of statewide standards puts public health at risk. AB 517 will help protect the health of body art consumers and practitioners and will provide local authorities an effective avenue for enforcing these standards. This bill will require practitioners to utilize single-use and/or sterilized tools, to be trained on blood-borne pathogens such as HIV and hepatitis, and will establish standards for sanitation and safety. It has broad support, American Red Cross, Blood Centers of the Pacific, and I think I will just leave the time open for my witnesses to talk more about that.
Thanks, Assemblywoman. Witnesses in support, please.
Mr. Chair, members, Justin Malone on behalf of the local environmental health directors. We're co-sponsoring the measure with the health officers. Firstly, I'd very much like to thank the committee consultants. They did an awesome job actually working with us. It's a complicated bill. It's a technical bill. But I would very much like to yield my time to 2 professional peers that can speak to the bill and how it affects the industry. Thank you.
Please.
See if it's on. There we go. Working? Yeah. Okay.
Yeah.
Hi, I'm Paul Stoll. I'm the owner of Body Manipulations. We are the nation's oldest, in fact, the world's oldest standing professional piercing parlor. We are an icon in our industry right here in San Francisco. And I'm just thrilled to see this bill passing into legislation. I'm very happy to see this. Over the last 10 years or so, I've seen our industry probably grow by, like she said, really a 400% increase in the last 10 years. We've moved our location, had to re-improve our infrastructure maybe 4 times. We've grown to that degree. And that's just one little business. Along with that time, I have a raising concern of other businesses out there performing the same sorts of services for the general public that perhaps are cutting corners, not being regulated, just to make a buck. I see this as a growing concern, and we've had these problems even locally. This bill finally secures everybody on the same page throughout the state. We have regulations for people to follow. There's no more, well, I didn't know I had to do that. And the enforceability is very important to me. I'm just thrilled to see this go. Thank you very much.
Next witness in support.
My name is Steve Joyner. I speak on behalf of the Association of Professional Piercers. We're an international association. Our profession started here in the state of California, and as to date, there are many countries and cities within our entire world that have minimum standards statewide. There are not minimum standards in California. And we work around the world helping write legislation, and they always look back to the state since the profession started here, and we're in deep support here for good standards within the state.
Thank you. Other witnesses for identification purposes only.
Bruce Palmer, co-sponsors, Bruce Palmer Health Officers Association of California, co-sponsors and strong support.
Thank you.
Lydia Bourne, representing the Blood Centers of California, and strong support.
Thank you. Mike.
Mr. Chairman, members, Mike Knudsen, I'm here on behalf, we're not in support of the bill. We were in opposition, and I'm here to remove my opposition and explain why, if the committee is interested.
Please.
I represent a Southern California company called Studex, which is the premier manufacturer of ear-piercing equipment, the equipment that you're all familiar with and that you've seen used in malls and that sort of thing. We were opposed to the bill in the version that came out of the Assembly. We have worked very hard with the author and with the committee staff and with the amendments that were in the analysis, and then the additional amendments, I guess the supplementary amendments that were done yesterday. We are no longer opposed to the bill.
Thank you. Any witnesses opposition? Seeing none. Will of the committee? Questions?
Mr. Chair, yes. Do we know if the Department of Finance is still in opposition? We have listed opposition.
Senator, I believe that was a sort of a stock letter that the Department of Finance sent us earlier on in the Assembly side, and it was basically an issue related to pressures on the department. We don't see any cost to the department. The department is actually written out of the bill.
Right. No, I was going to say, given that local entities can assess the fees necessary to cover any of the costs, and I think you've added language that specifically protects the general fund from any costs, which is why you're here, because you would otherwise have been stopped in Assembly appropriations. Just wanted to say that this is a debate that's been ongoing for a decade or more, and so it's appropriate that someone should have picked this up and brought all the stakeholders together. You've done that. You've done it successfully, and pleased to support the bill and to move it today. And welcome our guests from San Francisco.
The bill's been moved as amended. Assemblywoman, my understanding is that Chairwoman Alquist would like to be added as a co-author.
As co-author, yes.
Thank you. Secretary, please call the roll.
Senator Alquist. Strickland. Strickland, aye. Onnested. Onnested, no. Cedillo. Cox. Cox, no. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Aye. Pavley, aye. Woke. Aye. Woke, aye.
That bill has 5 aye votes. Remain on call.
Okay.
Thank you.
Thank you, members.
Assemblyman Emerson, you're up next. Assemblyman Emerson has file item 17, AB 1020.
Thank you, Mr. Chairman and members. First, I'm passing out some amendments, and I mock up of some author's amendments that moves up the compliance date to July 1, 2010, and makes other clarifying changes to the type of anti-entrapment devices being installed and the type of disciplinary actions a qualified individual would be subject to if they verify inaccurate information. As you know, drowning is preventable, but tragically it is the second leading cause of accidental death among children ages 1 to 14 in the United States. AB 1020 is a very important measure that will increase the safety standards for California's public swimming pools in order to prevent unnecessary drowning. In December 2008, Congress enacted the Virginia Graham Baker Pool and Safety Act, requiring all public pools to install anti-entrapment drain covers. This bill seeks to bring California into compliance with the newly enacted federal law, which is necessary to allow local health officials to properly enforce these new safety requirements. Furthermore, this bill would require every newly constructed public pool to be equipped with at least 2 main drains, significantly reducing the possibility of entrapment. Circulation entrapment occurs when a swimmer becomes stuck in a pool's drain suction and the pressure is so overwhelming that even healthy adults are sometimes unable to break free. If a child becomes entrapped, death or horrific injuries often occur. There were 74 incidents of circulation entrapment reported between 1999 and 2007, including 9 fatalities and 63 injuries, in which 54 of these incidents involved children under the age of 15. AB 1020 will help eliminate the risk posed to our children when our public pools and spas do not have the proper safety devices. I urge your aye vote on this measure. Thank you.
Thank you, Assemblyman. Witnesses in support.
Mr. Chair and Senators, I'm Peter Conlon, representing the Spa and Pool Industry Council. We're listed in the analysis as support as amended. The recent amendments have taken care of our concerns, so we're full support. Our members include the contractors who do this repair work. They both support the standards, and they also appreciate the compliance mechanism that the sponsor and the authors worked out to really help promote consistent application of this law. So we support it and appreciate that.
Thank you. Witness support.
Monica Guillen on behalf of the California Apartment Association. We submitted a letter to the author and sponsors early on outlining some significant concerns that the industry has with the bill, and I'm happy to say many of the amendments that have been taken we are very pleased with, and we'll be removing our opposition.
Thank you.
Gene Urban on behalf of the Pool Safety Council. We support the bill. We do have one observation, however. We appreciate the July 1st, 2010 compliance date, which I understand is in the mock-up that was handed out. We think that date should be even sooner. Under the federal law, compliance date was December 19th, 2008. We see no reason to needlessly delay. I had conversations with the department and the author, and I thought perhaps June 1st would work. We think 30 days to get to the beginning of the swimming season in 2010 would be another modest accommodation to promote the purpose of the bill, which is to prevent entrapment and entanglement. So we would ask you to consider a June 1st, 2010 compliance date, which is page 7, line 36. Thank you.
Other witnesses for identification purposes?
Mr. Strickland, members of the committee, Ron Kingston, representing the Community Associations Institute, a trade association of all the homeowner associations in the state, as well as the Apartment Association, California Southern Cities. As to Mr. Urban's issue as to when it ultimately should be enforced, we understand of when and appreciate when the federal law became into being, but generally speaking, as owners of these types of accommodations, we look at compliance dates as of January 1st or July 1st. They're just easy to remember. So we would prefer staying with the amendment that Mr. Emerson has proposed, and it would be just so much easier for a compliance and educational tool before our members. Thank you.
Thank you. Witnesses in support, any other? No. Witnesses in opposition? None. Assemblyman Emerson, I would like to be added as a co-author since you've amended it. Thank you. And I'll move the bill as amended. Secretary, please call the roll.
Senator Alquist. Strickland. Strickland, aye. Onnested. Cedillo. Cox. Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod.
Aye.
Negretti McLeod, aye. Pavley. Woke.
What's the number of that?
1020.
Wait, how many? The bill has 4 aye votes will remain on call. Thanks, Assemblyman.
Thanks very much. 1020.
Assemblywoman Hayashi. Cedillo, aye. Add that. The chair has requested did not go forward on your bill until she's here. So I'm sorry about that. Senator Leno, would you like to present on your bill? Members, this is file item 1, SJR 14. Senator Leno.
Thank you, Mr. Chair, committee members, for allowing me to present on SJR 14. It urges our federal government to end the medical marijuana raids in California and to finally create a comprehensive federal medical marijuana policy that ensures safe and legal access for patients. And of course, just to review the history of this issue in California, voters strongly supported Proposition 215 back in 1996, which, reading from the proposition itself, the Compassionate Use Act, quote, to ensure that seriously ill Californians have the right to obtain and use marijuana for medical purposes. Subsequent to that, I worked with Senator Vasconcellos in 2004 on SB 420, which helped to further implement the Compassionate Use Act. And then in 2008, of course, our Attorney General issued medical marijuana guidelines to all law enforcement in California. With regard to the issue of compassionate use or medical use of marijuana, a field poll of January 2004 showed that 74% of Californians approve of legal medical marijuana use, and in a Zogby poll of January 2009, 72% want the president to end federal raids of medical marijuana providers. So we're encouraged that President Obama and the new U.S. Attorney General Eric Holder have signaled a willingness to create a new federal policy with regard to medical marijuana. And in spite of this, the department raids have continued, most recently in San Francisco. So we need to get this resolved, and I think this resolution urges the President and Congress to do just that. And given Californians' support at the ballot for the compassionate use and the legislature's implementation of that voter-approved act, it is appropriate that our legislature clearly state its opposition to this federal interference and its support for expanded medical research and federal reform. I would ask for your aye vote.
Witnesses in support.
Good afternoon. My name is Don Duncan. I'm the California Director for Americans for Safe Access, the nation's largest organization of patients, doctors, researchers, and community members who are working to eliminate barriers to medical cannabis, both for research and therapeutic use. ASA is sponsoring SJR 14 and asking for your support today because the United States stands at a historic crossroads regarding medical cannabis, and it's more important than ever right now that the voice of the California legislature be heard on this issue. The White House and the U.S. Attorney General have signaled a willingness to adopt a new policy, but it's not clear yet what that policy will look like, and SJR 14 is the opportunity for this legislature to help craft that policy. And this is important because until federal law changes, legal medical marijuana patients and their primary caregivers in California are still subject to federal interference and intimidation, and that's the same federal interference that's stymieing the implementation of our state law right now. It's also important because SJR 14 calls on the federal government to allow medical marijuana patients in federal court to make a real defense by telling the jury that their conduct is legal under the state law. That's an option that's not available right now. And it also calls for an end to the block to the important clinical research that needs to be done to demonstrate the efficacy and the as yet undiscovered benefits of medical cannabis for patients who are suffering from HIV/AIDS, cancer, multiple sclerosis, and chronic pain, and other serious conditions. So we would ask you to join us in supporting SJR 14 to send that important message to Washington, D.C.
Thank you. Next witness. Hello, I'm Lynette Davies, and I work here in Sacramento as one of our ASA directors, and I also work with the Compassionate Coalitions and with the City of Sacramento and with agencies that are involved in medical marijuana. And I want to urge you to support this SJ 14. There's a few things in here that are pro, whether you're against or for medical marijuana, because this is a medical marijuana issue. And one of the things that this will resolve is research. Research is going to be very, very important. As people make alternative choices for their medication, we need to know the pros and cons. This resolution sends that message to Congress that this is a needed thing. So whether you support medical marijuana or you don't, please support this resolution for helping patients make those choices under education that we can provide for them. I also would like to address the trials. One of the things that many of our people here in California have been facing has been federal prosecution, and they have not been allowed within their prosecution to give a medical defense, even though that they are a medical patient. I was really surprised to find, even by just watching right down the street here on I Street at our federal courthouse, where we had patients that we're denied the right to tell the truth, the whole truth, as they see it. This is another thing that our patients have faced here in California and needs to be resolved with the federal government. And I think it's important that our legislators send that message to the government that, we're looking for protection for patients all the way around. Also, if they are prosecuted for whatever reason, that they at least have the right to tell the truth in a court of law. Again, I urge you to go ahead and sign on to this, whether you're pro for our cause or against our cause, because of the benefits that for society altogether. Thank you.
Thank you. State your name, please.
Glenn Backus for Drug Policy Alliance in support. Thank you.
Any opposition? Comments from committee? Is there a motion on the bill?
So moved.
It's been moved by Senator Cedillo.
And just a very brief close. We often have the debate within the legislature or in polite circles with regard to state rights. And the health and well-being of our citizens has always been a state's rights issue. And it's really quite amazing that we've got the federal government using some severe tactics at times to come in between the unique relationship of a doctor and a patient, going so far as to intimidate landlords that should they allow their rental space to be used by dispensaries in compliance with voter-approved state law, and that if they do allow their rental spaces to be used for such purposes, that the federal government will come down on them and take their property. This is an abuse of federal power, and I don't think we need the federal government involved here. 11 other states have followed our lead, do I have the number correct, and have voter-approved similar measures to our Compassionate Use Act. And I would ask for your aye vote so we can get the federal government out of raiding and intimidating property owners.
Thank you. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Honested? Cedillo?
Aye.
Cedillo, aye. Cox?
No.
Cox, no. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? It's got 4 ayes.
That bill has 4 votes. It's on call. Thank you. Wait a minute before we go.
He goes first.
Great. Assemblyman Block, file item 16, AB 995. Welcome.
Thank you, Madam Chair, members. AB 995 would exempt licensed physicians and podiatrists who keep a medical device or biologic product in their office before implanting or applying the product to a patient from registering as a California tissue bank. I have authors' amendments to address the concerns raised under number 2 and 3 on page 5 of the committee analysis that the sergeants will be passing out. Creating an additional licensing requirement and fee is required under current law for physicians and podiatrists who lawfully obtain these products from a California licensed tissue bank and use and store them in accordance with existing federal laws and FDA-approved manufacturer guidelines for direct patient care could ultimately jeopardize the patient's access to these advanced products and delay the healing process. These medical devices and biologic products are approved by the FDA to treat diabetic foot ulcers and venous leg ulcers. These wounds are very painful, last for many years, and are the most frequently occurring chronic wounds suffered by patients today. The exemption for physicians and podiatrists would facilitate treatment of these wounds. I want to thank the committee chair, Senator Alquist, and committee consultant Peter Hansel for their assistance in working on this measure. And with me here to testify in support of the bill are the sponsors, Shane Guzman representing the California Podiatric Medical Association, George Dunn with Advanced Biohealing Incorporated, Tom Bone and Heidi Fermani representing Organogenesis Incorporated.
Thank you. And the bill's been moved as amended. That's a very good sign. And 2 witnesses, 2 minutes each, and others to state their name.
Madam Chair, members of the committee, Shane Guzman on behalf of the California Podiatric Medical Association. The author summed up the bill very well. This is really about access to care for us. We have been what we consider the end user of this product. We don't distribute tissue. We don't engineer it. We simply treat our patients with it. And I don't think we were ever the intended target of the original tissue bank licensing law. If we were required to license, it's very expensive and has very significant record-keeping requirements. And our fear is that some of our clinicians would simply, because of the lack of funds, simply stop performing these important procedures. And what we're really talking about is diabetic wound care, and we want to make sure that those folks still have access to care, so we urge your support.
Madam Chair and members, Tom Bone on behalf of Organogenesis, one of the manufacturers of this human cell tissue-based product. We have worked very hard, and we appreciate all the hard work by both the committee staff and the author's staff in helping us craft this very narrowly. The amendments that are being adopted today significantly narrow and target the bill appropriately. We think that we've met all the necessary requirements that would make sure that patients are safe, and that physicians and podiatrists can continue to provide these vital services. I'm here to answer any questions, but we do urge your aye vote.
This is George Dunn, representing Advanced Biohealing, a La Jolla-based manufacturer of the product, and we also urge the support of the bill.
Is there opposition? Comments from committee? Thank you. It has been moved as amended by Senator Strickland to approps. So we will call for the vote.
Senator Alquist.
Aye.
Alquist, aye. Strickland.
Aye.
Strickland, aye. Onnested. Cedillo.
Aye.
Cedillo, aye. Cox.
Aye.
Cox, aye. DeSagne. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Woke. It's got 6.
That bill has 6 votes, which is enough to get out, but we're holding all the bills on call till the very end.
Thank you, Madam Chair.
Thank you.
Thank you, members.
Thank you. Assemblymember Hayashi, and this is a file item 20, AB 1235.
Thank you. I'm here to present AB 2035. I'll be taking as author's amendments this was suggestions made by the committee consultant. This is a district bill. It just gives Alameda County Fairmont Hospital until July 1st, 2010. It's just an additional 6 months to come up with a plan to rebuild its rehabilitation hospital to meet the seismic standards.
Madam Chair, I'd like to move the bill as amended.
The bill has been moved as amended.
Thank you. I ask for your aye vote.
Witnesses in support? In opposition? Comments from committee?
Is this not comparable to the bill we moved for Assemblymember Emerson last week?
They're all very different, but it's narrow in scope and gives a little time for the hospital to
Madam Chair.
make its plans. That's what the bill does. It's a good bill in its current form. As the representative of this, as the Senate's representative of the Seismic Safety Commission, I am not voting on any of the bills dealing with seismic safety retrofit because, as I've said before, I think we're going to have some very big earthquakes, and I really want to see hospitals understand what could happen. But all members are free to vote as they choose.
Thank you.
Madam Chair,
Cox.
I too today will support this bill. I am a little bit concerned, however. We have had a rather systematic approach to the extension of the seismic retrofits. And it is a situation now we're just doing, this is just a one hospital unit from that standpoint that's getting a 6-month extension. And my judgment tells me that now that we have someone who's come forward and has gotten a 6-month extension for whatever reason, we then will have another hospital come in and give us another illustration. Is this the second one? So while I'm going to support it, we ought to make it very clear that if you've got a problem, you need to get here right away as opposed to waiting until the very last minute.
Exactly.
Because the legislature might very well be in a situation where it doesn't have the ability to be of assistance to you. And to you, sir, if you're the administrator, okay, whomever, whomever, they have known about this for some time. Senator Alquist husband put in the seismic bill to begin with. We in fact got some extensions a couple of years ago, and they were very hard-fought extensions. Mr. Capel was one of the sometimes supporting and sometimes on the other side of the aisle. But we need to have some consistency here. But I am going to support this today, but we need to recognize that there is need for consistency.
That's a good point, and I think we're very much in line on this issue. And at some point, we'll have a more in-depth discussion. There have been bills that we are now seeing that have come to us in other forms, and I have seen that they are modified to be reasonable in only truly emergency situations. So I am saying to members in both houses that there are going to be bills that members may think are emergency situations which will not be. So this is a very limited bill, and we will have a further discussion. I appreciate Senator Cox's comments. Now, the bill's been moved, is that correct? Are there other comments? No. Okay, so you may briefly close.
Thank you very much. This is an important bill for my district. I appreciate your support.
Thank you. Call for the vote, please.
District bill.
Senator Alquist?
Aye. Oh, no. That was I abstain.
I think I was being too persuasive with my close.
Strickland? Aye. Strickland, aye. Honested? Honested, aye. Cedillo?
Aye.
Cedillo, aye. Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke?
Bill has 6 votes. It's enough to get out, but we're holding them all on call
Thank you,
for now,
Madam Chair.
till the end. Thank you.
Thank you, members.
Assemblywoman Buchanan, file item. Okay, first I should say that file item 19 has become a 2-year bill at the request of the author. Yes, that was AB 1140, Nilo. Now, members, we have 3 bills left. The first one is by Assemblywoman Buchanan, which is file item 21, AB 1307. Welcome.
Thank you very much, Madam Chair. I'm happy to be with all of you this afternoon and appreciate the opportunity to present AB 1307. In 1966, with the screening of only one condition, the California legislature has been the key driver in expanding our state's newborn screening program. Most recently, cystic fibrosis, BD, and BD were added in the 2006 Budget Act. Newborn screening to detect disorders such as sickle cell anemia or PHU can prevent severe disability, mental retardation, and even death. AB 1307 will require the California statewide newborn screening program to include all conditions recommended by the American College of Medical Genetics and to add future recommendations of the ACMG or any advisory body appointed and approved by the United States Secretary of Health. If the Department of Public Health determines that any recommendation is not necessary for advancing California's newborn health, it must notify the legislature of its determination. Currently, there are only 2 states that screen for all 54 disorders recommended by the ACMG. I believe that California should be one of the leaders because our children deserve no less. This measure is supported by the California Medical Association, the Nurses Association, the March of Dimes, ASME, the California Healthcare Institute, as well as the Hunter's Hope Foundation. And it has, to date, received strong bipartisan support.
Thank you. Hello, witness in support.
Mike Carpenter with the California Healthcare Institute. We represent about 250 biomedical companies, the companies that research and develop these therapies. The bottom line is newborn screening works, and it is a good way. It's great prevention, and we'd like to see that the program gets continued so that our therapies can get to the people who need them. Thank you.
Thank you. The bill has been moved by Senator Negrete McLeod. Were there any other comments? Would you, Assemblywoman, would you like to very briefly close?
Yes, I will just ask for your aye vote. Thank you.
Thank you. We'll call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? Onnested, aye. Cedillo? Cedillo, aye. Cox? Sorry. Cox, aye. DeSaulnier? Leno? Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? Strickland, aye.
That bill has 7 aye votes. It is on call. Members, what we're going to do, we have one bill that may be heard yet, depending on 2 bills by the same author, yes.
I can do them. I sit on the Senate bill. We heard them.
Well, why don't you do that? Why don't you do that?
Yeah, let's do that.
Let's do that.
Support on both sides.
And there is support on both sides. So we'll start with file item 23.
No, 25, ma'am.
I mean
Madam Chair.
25. I'm sorry. I mean file item 25, AB 1568, by the Assembly Veteran Affairs Committee.
Thank you, Madam Chair.
Move the bill.
Okay. That's okay. I heard these.
And before you speak, I'm just going to take one moment to say we need members of this committee. It is now 4:30, and I will do go through the roll. I mean the bills twice. One because some members have sat here patiently for a long time, and we'll do that right away. And then I will do it one more time at 4:40. And that's where it will be. Okay.
Thank you, Madam Chair. 1556, 68, ask for your aye vote.
Thank you. The bill has been moved by Senator Cox. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onnested?
Aye.
Onnested, aye. Cedillo?
Aye.
Cedillo, aye. Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod?
Aye.
Negretti McLeod, aye. Pavley? Woke?
That's got 7. I realized that I did not call for support. Oh, it wasn't support. Okay. Would you like to come forward? I'm sorry. I did not, yes.
Were you in opposition?
Submitted a letter of concern on the bill.
On the first one?
1568, yeah.
I apologize. Do you want to come up and speak? And I can.
I'll do it very briefly.
Oh. Well, wait.
Deborah Doctor from Disability Rights California. Oh.
She said she has a letter of concern and we never received a letter.
Oh, really? Okay, this is on the 1571?
I'm told that we are not supposed to take testimony
Yeah, that's fine.
once the motion has been passed, and I apologize. All right, Assemblymember Salas, good to see you.
Yes, thank you very much. I'm sorry to keep you waiting.
And on what was the final
Okay.
vote on?
7-0.
On AB 1568, the vote, there was 7 votes for it, but I'm not announcing it as passed because we're going to go through the whole roll. Okay.
All right,
Now this,
and since it's already been voted on, did you want me to...
I would just like you to present on file item 26, AB 1571.
Okay, fantastic. So 1571 is a bill that will help address the mental health needs of our returning veterans. AB 1571 is a simple, straightforward bill. It requires that local mental health planning groups include veterans and veterans representatives from veterans organizations and stakeholder groups that help to develop their local plan. This bill has received bipartisan support in the Assembly Committees on Health, Veterans Affairs, and Appropriation, and the Senate Veterans Affairs Committee. In order to address the opposition to the bill, I have further amended the bill to remove the plan that referenced including veterans in specific parts of the plan. These amendments have removed all major concerns and represent a compromise that will hopefully provide us with much-needed information about how we are treating the mental health needs of our returning veterans. We recognize that it is a responsibility of the federal government to provide mental health services to our veterans, but for too long, the U.S. Department of Veterans Affairs has focused on the physical and not the mental health of our veterans. It is also becoming painfully clear that too many of our veterans are returning, especially from Iraq and Afghanistan, suffering from post-traumatic stress syndrome and/or severe head trauma. California needs to be prepared for the war veterans that are beginning to come home, and we must be ready to care for the estimated 50,000 veterans who will return with PTSD. And even though we should not have to, our county health care system must be prepared to be the safety net for our brave soldiers and their families. We owe it to our veterans and our returning National Guard members to begin addressing the pressing problems now. Thank you, and I ask for your support.
Move the bill as amended.
The bill's been moved as amended. Witnesses in support.
She was going to consider she's going to take it. She's going to work on this in appropriate committee. One of these two.
Oh, and you want to mention what you were going to consider taking in appropriate that you are working on?
Comment one.
Comment one.
Oh, yes. And we will be taking the amendments that were indicated under the comment section, which will require the DMH to use the MHSA state administrative funds to contract out for a study of existing programs and services provided to veterans to identify the number of veterans that are currently being served.
Thank you. I wanted the committee to understand that. Fine. Witnesses in support?
Hi, Kirsten Barlow with the California Mental Health Directors Association and also representing the California State Association of Counties here today to support the bill and to offer really our major appreciation to the author and her staff for working with us really closely over the span of a few months to reach agreement on the bill. And as it's amended, we now fully support the provisions of the bill. Thank you.
And thank you very much. And that was a compromise that I mentioned in my statement, and I also would like to thank all the stakeholders for coming to an agreement.
Thank you. Comments from committee? The bill has been moved by Senator Strickland as amended. We'll call for the vote, please.
Senator Ahlquist?
Aye.
Ahlquist, aye. Strickland? Aye. Strickland, aye. Onnested? Onnested, aye. Cedillo? Aye. Cedillo, aye. Cox? Aye. Cox, aye. DeSaulnier? Leno? Aye. Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Woke? Aye. Woke, aye.
Thank you so much.
Thank you.
8 aye votes.
That bill has 8 aye votes. What we're going to do is we'll go through the votes twice, since we do have some members who are not here. Before we do that, I'd like to say, since no one who is here now has to stay later, that this is our last regularly scheduled hearing, and we may be having some hearings after the recess, but this is the last regularly scheduled one. I want to thank my vice chair, Tony Strickland, who, because there have been times I've been presenting a bill or I've been in my other committee, Rev and Tax, which Senator Woke chairs, Senator Strickland has done a great job running the committee. I'd like to acknowledge our fantastic committee staff who have put in really hard hours. I have chaired some very complex committees over the years, and certainly this is one of the most, has one of the most complicated bills and intriguing bills and thought-provoking bills. I'd like to thank, I really would like to thank the staff who've done a great job, and to mention that Lark will be leaving us, Lark Park, to go to Human Services, and that Mia has joined us, who's also doing a very good job. Pardon me?
Lisa Chan.
Mia
is our new replacement for Lark.
Right.
I'm sorry. Lisa Chan Solomon is
I'd like to echo from our perspective as vice chair, the great work of our chairwoman. She's done an incredible job, Elaine Alquist. She's done a great job as chairman of this committee, chairwoman of this committee. I'll also like to echo the great work from all the staff. This committee's been run really well, and it's just been a pleasure. Also thank the members, and looking forward to next year.
Some more really interesting bills, and I also would really like to thank the committee members because I realize we come from all different perspectives on health care, and that probably more than any other topic, there is great emotion and heart and spirit in the discussions. And I think that we've all been very respectful of each other and have been allowed to say what we think. And this challenging situation will continue in the coming year. So we'll leave it there, and we'll go through the bills twice since we still, I don't think everybody is here quite. Is there anyone? Well, Ms. Pavley's not here. Is she the only one?
And Maldonado's not here.
And is Abel around? He's not here today. So, all right. Well, I said we would do the final vote at 4:40, didn't I?
Is Senator Pavley coming back?
Do we know if Senator Pavley is? Well, if you don't mind, we'll wait 60 seconds, and then we'll do one call. And I'm doing 1 minute.
Sadir just stepped out.
Well, we're doing it one time.
Thank you, Madam Chair.
Thank you.
Thank you.
She's voted on almost everything, but I think she was here and didn't vote on a couple. Okay.
I may need her on mine.
Oh, you think? Well, Desagne's here. Pavley is here. And Desagne is here. Desagne is here, and Pavley. I mean, Woke's here. Oh, okay.
Okay, members, we're just going to do one once through, and it is 4:44, 4 minutes beyond the time I said we would do this, so let's just begin. File item 1, SJR 14 by Senator Leno.
On the motion to be adopted, Senator Onnested? Onnested, no. Desagne? Aye. Desagne, aye. Maldonado? Pavley? Woke? Aye. Woke, aye. That bill has 6-3. It's out.
Senator Pavley's here.
Oh. Senator Pavley on item number 1, SJR 14?
Yes, that's an aye.
Aye.
Senator, wait a minute. Is Senator Cedillo? Senator Cedillo, did you vote?
He's already voted on it.
Okay, and how many votes does it have?
7-3.
7-3, that is out. File item 3, AB 56.
Take up the consent bills.
Okay.
There's only 6 people here.
Okay, we have 2 bills on consent, SJR 15 Alquist and AB 830 Cook.
On the motion be adopted as amended to consent, Senator Strickland?
Aye.
Strickland, aye. Cedillo?
Aye.
Cedillo, aye. DeSagne?
Aye.
DeSagne, aye. Leno?
Aye.
Leno, aye. Maldonado. That's 10-0.
10-0, consent calendar out. File item 3, AB 56 by Assemblymember Portantino.
On the motion do pass to appropriations, Senator Strickland? Cedillo? Cedillo, aye. Leno?
Aye.
Leno, aye. Maldonado? Pavley? Pavley, aye. 7-2 is the final.
7-2, that is out.
Oh, okay. I wasn't sure if you wanted to do that.
No, that's fine to do it. Okay, file item 4, AB 244 by Assemblyman Bell.
On the motion do pass to appropriations, the chair voting aye. Senator Strickland?
No.
Strickland, no. Onnested?
No.
Onnested, no. Cedillo?
Aye.
Cedillo, aye. DeSagne? DeSagne, aye. Maldonado? Negretti McLeod? Pavley? Pavley, aye. Final vote is 6-3.
The vote is 6-3. The bill is out. File item 5, AB 366, Assemblymember Ruskin.
On the motion do pass to appropriations, the chair voting aye. Senator Onnested?
Aye.
Onnested, aye. Cedillo?
Aye.
Cedillo, aye. DeSagne?
Aye.
DeSagne, aye. Maldonado? Pavley? Pavley, aye. The bill is 10-0.
10-0, that bill is out. File item 6, AB 398 by Assemblymember Monning.
On the motion do pass as amended to appropriations, Senator Onnested? I'm sorry, with the chair voting aye. Senator Onnested?
Aye.
Onnested, aye. Cedillo?
Aye.
Cedillo, aye. DeSagne?
Aye.
DeSagne, aye. Maldonado? Pavley? Pavley, aye. It's 10-0.
That vote is 10-0. The bill is out. File item 7, AB 513 by Assemblymember De Leon.
On the motion do pass as amended to appropriations with...
I think it can. Oh, well, I don't, if he didn't take amendment.
We took amendments.
Yes, you did.
Yeah, Leno and Alquist are...
Yes, you can do that. You're welcome. Okay. So, did we finish file item 7?
No.
File item 7, AB 513, Assemblymember De Leon.
On the motion do pass as amended to appropriations with the chair voting aye. Senator Onnested?
No.
Onnested, no. Cedillo? DeSagne?
Aye.
DeSagne, aye. Maldonado? Negretti McLeod? Pavley?
Aye.
Pavley, aye.
Cedillo, aye.
Cedillo, aye. That vote is 6-3.
6-3, that bill is out. File item 8, AB 517 by Assemblywoman Ma.
On the motion do pass as amended to appropriations, Senator Alquist?
Aye.
Alquist, aye. Cedillo? Cedillo, aye. DeSagne? DeSagne, aye. Maldonado? It's 8-2.
That vote is 8-2. The bill is out. File item 9, AB 564 by Assemblymember Portantino.
On the motion do pass as amended to appropriations with the chair voting aye. Senator Strickland?
No.
Strickland, no. Cedillo? Maldonado? Pavley? Pavley, aye. 7-2.
The vote is 7-2. The bill is out. File item 10, AB 591 by Assemblymember Delatorre.
On the motion do pass as amended to appropriations with the chair voting aye. Senator Onnested?
No.
Onnested, no. Cedillo? Cedillo, aye. DeSagne?
Aye.
DeSagne, aye. Maldonado? Woke?
Aye.
Woke, aye. 7-3.
7-3, that bill is out. File item 11, AB 627 by Assemblymember Brownlee.
On the motion do pass to appropriations with the chair voting aye. Senator Onnested?
No.
Onnested, no. Cedillo? Cedillo, aye. DeSagne? DeSagne, aye. Maldonado? Pavley? Pavley, aye. Woke? Woke, aye.
7-3, that bill is out. File item 12, AB 754 by Assemblyman Chesbro.
On the motion do pass to appropriations with the chair voting aye. Senator Onnested?
Aye.
Onnested, aye. Cedillo? Cedillo, aye. DeSagne? DeSagne, aye. Maldonado? Pavley? Pavley, aye. Woke? Woke, aye. That's 10.
10-0, that bill is out. File item 13, AB 786 by Assemblyman Jones.
On the motion, due pass to appropriations, with the chair voting aye. Senator Onnested? No. Onnested, no. Cedillo? Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Woke? Aye. Woke, aye.
73, that bill is out. File item 14, AB 830 was on consent, which we voted on. File item 15, AB 911 by Assembly Member Liu.
On the motion, due pass is amended to appropriations with the chair voting aye. Senator Strickland? Aye. Strickland, aye. Cedillo? Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Leno? Aye. Leno, aye. Maldonado?
9-1, that bill is out.
That was file item 15. You are.
Next, we have file item 16, AB 995 by Assemblymember Block.
On the motion, due pass is amended to appropriations with the chair voting aye. Senator Onnested? Aye. Onnested, aye. DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Pavley? Aye. Pavley, aye. Woke? Aye. Woke, aye.
10-0, that bill is out. Next, we have file item 17, AB 1020 by Assemblymember Emerson.
On the motion, due pass is amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. Onnested? DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Pavley? Pavley, aye. Woke? Woke, aye. 9-0.
9-0, that bill is out. File item 18, AB 1076 by Assemblymember Jones.
On the motion, due pass is amended to appropriations with the chair voting aye. Senator Onnested? Aye. Onnested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Woke? Woke, aye.
9-1, that bill is out. As I mentioned earlier, file item 19, AB 1140 by Assemblymember Nilo was, at his request, made into a 2-year bill. So next we have file item 20, AB.
He just put it over.
He just put it over. File item 20, AB 1235, Assemblymember Hayashi.
On the motion, due pass is amended to appropriations with the chair abstaining. Senator DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Pavley? Aye. Pavley, aye. Woke? Aye. Woke, aye.
Seismic safety, I abstain on seismic safety bills, but it's I think a reasonable bill. I'm just not going to associate myself with anything that extends retrofit.
Senator Woke, aye to not voting. So it's 8-0.
8-0, that bill is out. File item 21, AB 1307 by Assemblymember Buchanan.
On the motion, due pass to appropriations with the chair voting aye. Senator DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Pavley? Aye. Pavley, aye. Woke? Aye. Woke, aye.
10-0, that bill is out. File item 22, AB 1449 by Assemblymember De Leon.
On the motion, due pass is amended to appropriations with the chair voting aye. Senator Onnested? Aye. Onnested, aye. Cedillo? Aye. Cedillo, aye. Cox? DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Pavley? Aye. Pavley, aye.
9-0, that bill is out. File item 23, AB 1541 by the Assembly Health Committee.
On the motion, due pass is amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. Onnested?
Aye.
Onnested, aye. Cedillo?
Aye.
Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Woke? Aye. Woke, aye. That's 10-0.
10-0, that bill is out. Next, file item 24, AB 1544, Assembly Health Committee.
On the motion, due pass is amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. Cedillo?
Aye.
Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Maldonado? It's 10-0.
10-0, that bill is out. File item 25, AB 1568 by the Assembly Veterans Affairs Committee.
On the motion, due pass to appropriations with the chair voting aye. Senator DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Pavley? Aye. Pavley, aye. Woke? Aye. Woke, aye. It's 10 to 0.
10-0. That bill is out. Members, the last item is file item 26, AB 1571, by the Assembly Veteran Affairs Committee.
On the motion, do pass as amended to appropriations. Senator DeSagne. Oh, with the chair voting aye. Senator DeSagne. DeSagne, aye. Maldonado? Pavley? Aye. Pavley, aye. 10 to 0.
10-0. That bill is out. Meeting adjourned.
You do a great job there.